Good afternoon.
Good afternoon, Madam Chair.
Welcome to the Senate Finance Committee. Today is Wednesday, February 4th. We are going to hear 8 bills today. I'm going to read the bill order, starting with Senate Bill 53, Senator Simon Ayer, who I see is here. You can come to the table, Senator. Then Senate Bill 296, 95, Senate Bill 120, Senate Bill 156, Senate Bill 272, 286, and 304. That's the order unless members are called out to other committees. You see empty seats because we're all testifying in other committees too. So if you see us come and go, it's not because we don't want to hear your testimony. We're just being called to another committee. I remind everyone that your testimony is 2 minutes. Please honor that because we have a busy day. And we are going to start with Senator Simon Ayer.
Thank you, Madam Chair. I'll make it less than 2 minutes. As the chair knows, our delegation voted favorably for this local bill with additional co-sponsors. What this bill does, in addition to the county executive, this bill requires the Port Administration to notify the Anne Arundel County delegation when they plan to acquire or develop land in our county, as public engagement is key for a successful project. I worked with the Port over the interim and took their input. They just recently came back with a possible amendment. So after I discussed with them, I think I'm drafting an amendment that make it even better. So I'll take it back to the delegation, and then we can revisit that. With that, I would ask for your favorable consideration.
Thank you, Senator. I have a question about your amendment.
Sure.
Is it the amendment that would require the county to alert us 2 weeks before they schedule a hearing?
I did talk with the county. They didn't want that. So there's a couple things. One is when the Port notifies the county executive, part of my amendment would simply just be tell the delegation as well at the same time, whether a CC or written, whatever.
Okay.
So they already have the process in place. It would just include other people.
Thank you, Senator. Do I have any other questions for Senator Simon Ayer on Senate Bill 53? Seeing no question, that ends the testimony. Thank you very much.
All right, colleagues, next bill we'll hear is Senate Bill 276, and that bill is sponsored by our very own Senator Beidel.
Mr. Vice Chair, may I bring up my panel?
Absolutely, Madam Chair.
Is it 6?
Jonas, John, Layla, someone from and Cheryl.
There we go. Thank you. Thank you, Tammy. Good afternoon, Vice Chair Hayes and members of the Senate Finance Committee. You've heard a similar bill to this bill before. This is Senate Bill 276. 2 years ago, we passed a bill on prosthesis, and this bill, and at that point, we eliminated orthosis because we had budget issues. So this bill reintroduces the requirement for orthosis. But I want to remind you back when we had the prior Senate bill, So Everybody Can Move Act. Do you remember the little guy, Nathan, that testified to us about how important his prosthesis would be to playing baseball? Well, he's now 5'9" and has a mustache, but he's also getting a new baseball leg that will be covered by his insurance because of the bill we passed. So he's done very, very well in baseball and is very happy. He's not the only life that was changed by our passage of Senate Bill 614 during 2024. Marylanders across the state have been able to receive prosthesis to participate in water sports, at the beach, play lacrosse, do gymnastics, all activities they could not safely do before we passed Senate Bill 614. However, we were unable to help everyone that year as we needed to remove coverage for activity-specific custom orthosis for that bill to pass. Senate Bill 276 reintroduces coverage for custom orthosis for physical activity. Orthosis or orthotic devices are external braces used to treat congenital, neuromuscular, musculoskeletal disorders, as well as acquired conditions. The bill matches the coverage and language of the prosthetics bill that unanimously passed the Senate in 2024. The disability community is at a significant higher risk of inactivity compared to their able-bodied peers. 50% of adults with disabilities get no aerobic physical activity, and the prevalence of obesity among children with mobility impairments is twice that of children without disabilities. This legislation will change lives and significantly decreases costs associated with serious comorbidities of physical activities, diabetes, cardiovascular disease, just to name two, with a small upfront cost. Maryland can also learn from other states that have already passed this legislation. There are now 7 states providing coverage for activity-specific custom orthosis. In states where these laws have been in effect for over 1 year, there has been little to no impact on insurance premiums. You will hear shortly from advocates who will provide additional insight on this data. Together, we can help ensure that Marylanders have access to medically necessary custom orthosis for physical activity. I appreciate your consideration and respectfully ask for a favorable vote on Senate Bill 276. Thank you. Next, whatever.
I'm John Singer, and I support SB 276, which would require insurers to replace broken medically necessary orthotics. I thank my wife Karen for coming today. She submitted, as did my children, statements about how orthotics have benefited not just me, but my entire family. I passionately believe that anyone who needs orthotics should be able to obtain them. My interest began about 12 years ago when the muscles below my knees in both of my legs stopped working. I was a fall risk, could not walk safely, and could not stand without support. About 4 years ago, I was prescribed ankle-foot orthotics, AFOs. You can't really see them here, but I am wearing shorts on this cold February day so that you can see them if you would like. With my AFOs, I again enjoy common activities that most take for granted, like walking my son down the aisle to his wedding without assistance. I no longer need to lean on my wife to stand without wobbling. And I again can walk significant distances, travel, engage in activities that maximize my whole body health. I am not at all passive. Though life-changing, AFOs and other orthotics are neither perfect nor inexpensive. On 2 separate occasions, after less than 3 years of use, each of my original AFOs broke while walking down steps. When I sought replacements, I learned that my insurance coverage would only pay for a replacement AFO after a seemingly arbitrary 5-year time period set out by the insurer. I faced a choice. I could pay $1,100 from my own pocket for each AFO replacement, $2,200 for both, or wait years until the 5-year time period expired. This is a difficult choice for most people. At best, the replacement causes a financial hardship. And for many, unfortunately, paying the replacement cost is impossible, and the only option is to go without an orthotic. By enacting the bill, no insured Marylander will face financial hardship to obtain a new orthotic, or even worse, be told they are out of luck and will have to go without a replacement through no fault of their own and despite diligently paying insurance premiums. I'm happy to address any questions that the senator might have and to demonstrate how I walk with and without my orthotics, or you just take a look at them so you can see up close how they look and how much of a difference they have made in my life. Thank you very much for your attention.
Yep, I'll go next. Good afternoon, Senator Beidel and members of the Senate Finance Committee. Thank you for the opportunity to speak today. My name is Jonas Young, and I'm a certified orthotist prosthetist with about 15 years of experience specializing in pediatric care. I'm here on behalf of So Everybody Can Move in strong support of SB 0276. For the past 15 years, I've worked with children who rely on orthotic devices, not just to stand or walk, but to truly participate in life. For many of my young patients, activity-specific orthoses, such as devices designed for running, jumping, swimming, or adaptive recreation, can be the difference between watching from the sidelines or being fully included by their peers and family. Orthotic devices can kind of be a tough concept to wrap your head around. How does something which externally realigns a body segment play a key role in facilitating recreational activity? Why would this need to be activity specific, and how does it enhance the lives of our patients? Well, I've got a story that'll hopefully address all 3 of those. I have a patient who I've been seeing for years with hemiplegic cerebral palsy. I'd been seeing her mostly for a device for her lower extremities to help with mobility and ambulation, but at one of our appointments, I learned that her and her family were all avid kayakers, but my patient hated it, mostly because she couldn't hold a paddle or participate in the activity. She was just passively in the kayak while her parents paddled her around. We designed her a wrist hand orthosis, which would allow her to hold and manipulate the paddle so she could help propel and steer the kayak. Before even seeing the family again, they were filling my inbox with pictures and videos of my patient paddling a kayak, splashing her brother with a paddle, all with a giant smile on her face. They were fortunate enough that they could afford this out of pocket, but with the passage of SB 0276, this will provide an opportunity to expand that care to all patients. Thank you very much.
Good afternoon, Vice Chair Hayes and members of the Senate Finance Committee. My name is Layla Tias, and I'm here in support of Senate Bill 276. I'm 21 years old and a senior at the University of Maryland. When I was 18, I lost my left leg pretty suddenly to a blood clotting disorder. I also sustained partial amputations to the toes on my right foot. Prior to that, I was very active. I played soccer throughout my childhood, and I ran track for my high school. I remember when I was younger, a frequent theme of my health classes was the importance of exercise. Gym class has always been required, and kids were encouraged to move for at least 30 minutes a day. Generally, physical activity seemed widely understood as an important part of staying healthy. When I lost my leg, the message changed, and the devices I needed to keep up with my prior lifestyle were now deemed not medically necessary. Despite this, I was fortunate enough to receive a grant from the Challenged Athletes Foundation for a running leg. Being able to return to running again has been so exciting. It's hard to explain how freeing and thrilling it is to be able to return to an activity that used to be so natural. Now, with the So Everybody Can Move Act passed in 2024, activity-specific prostheses are covered by insurance, and I'll have more consistent access to the prosthetic legs I need to stay active. Orthotics present a similar issue. I don't currently use an orthotic on my sound leg, but as I get older, a custom orthotic will likely be something I'm going to need to keep up with my desired lifestyle and something I'm going to need to maintain my physical well-being. I read through the written testimonies provided with the previous introduction of this legislation when preparing what I wanted to say today, and a lot of them talk about the costs, statistics, and technical aspects of this bill. Certainly, all of this is important when considering legislation, but it's hard to quantify the impact that a bill like this would have on an affected individual, including myself. For me, the same day they told me I was going to lose my leg, I began researching how I was going to keep doing all of the activities I love. Everyone deserves to live an active lifestyle, and movement should not be cost prohibitive. Exercise is a form of preventative care. This bill recognizes that and allows people who use orthotics to support their own health and quality of life. With that, I ask for a favorable vote for Senate Bill 276. Thank you for your time.
Good afternoon, Madam Chair, Vice Chair, members of the committee. My name is Krishnaj Gaurav. I'm a physical medicine and rehabilitation doctor, been practicing for about 12 years now. Currently serve as the Chief Medical Officer at University of Maryland Rehab and Orthopedic Institute. As you may know, we have around 20,000 or more visits every year serving patients with various kinds of musculoskeletal and neurological disorders. And I'm here to speak in favor of Senate SB 276. And to illustrate the importance of this bill, let me try to give you a patient story. This is a true story. I was treating a patient who had an incomplete spinal cord injury. Now, before his injury, he was very active in the community. He loved outdoors, and his favorite activity was hiking with his family. That's how he bonded. After the injury, of course, both his legs were paralyzed, but he was a very hard worker. He received excellent therapy for about 6 months. Because of his own hard work, he was able to now stand and walk a few steps inside his house. So we prescribed him an orthosis, a brace in the back of the leg, an ankle-foot orthosis that would help him walk and prevent him from falling and tipping on his weak leg. And he continued to work hard. And after a few months, he asked me that, okay, I really want to hike, even if it's for a very short distance, even if it's for I can spend some time with my family while hiking. That's what I love to do because that is important for my physical health, my mental health, and that's how I will maximize my physical capacity. And I wanted to prescribe a custom-made orthosis for him that will allow him to walk in uneven surfaces while still keeping him safe. In the current state of affairs, insurance companies can come back and say, no, that is not medically necessary. And we want to change that. We want to change that for patients like him who want to maximize their physical capacity, their functional status, and therefore I'm requesting this committee to please vote favorably for Bill 276. Thank you for your time.
Thank you so very much for your testimony. Are there any questions for this panel? Oh, where's the other person?
Hi, sorry, I'm in the middle.
Gotcha. All right,
Snuck in.
there you go.
I'll keep it under 2 minutes, I promise. Madam Chair, Vice Chair, members of the committee, my name is Cheryl Sachs, and I thank you for the opportunity to testify in favor of Senate Bill 276. I am a certified prosthetics and orthotics practitioner and have been practicing here in Maryland for the past 14 years. I have also been an active advocate for Maryland So Everybody Can Move initiative for the past 3 years. As you have heard from the other advocates on this panel, this legislation facilitates the ability to provide life-changing, medically necessary patient care for individuals who require an additional custom orthosis for physical activity. This bill, Senate Bill 276, is about more than coverage. It is about fairness, dignity, and the fundamental right to movement. It is an investment in the generational health of your constituents and in the physical, social, and mental well-being of Maryland's disability community, children and adults alike, as well as their families and communities. The details as to why I am so passionate about this work are in my written testimony. I do want to highlight the fiscal note briefly, which states that this initiative in this bill would greatly benefit Marylanders who require additional custom orthoses for physical activity with no impact on the Maryland Medicaid program and no meaningful impact on the state employee and retiree health and benefit programs. Thank you to Senator Beidel for your continued leadership in ensuring all Marylanders have access to the prosthetic and custom orthotic devices they need to live healthier, active lives. And to this committee, thank you so much for your time, and I respectfully ask for your favorable report on Senate Bill 276.
All right, now that actually ends the testimony of this panel. Senator Hershey.
Thank you very much, Mr. Chair. And Madam Chair, I'll ask you, but if you want to send to somebody else, that's fine. I'm just looking at the Department of Health's letter of information, and it does say the department notes that these services are already covered by Maryland Medicaid. And it goes on to say, following the completion of a legislative required report in December 2024, MDH engaged with stakeholders and clinicians to identify a list of 132L codes for custom orthosis, custom orthosis used with physical activities to maintain whole body health. And I think this is what we talked about in the previous years. But then it says, effective January 1st of this year, MDH updated its disposable medical supplies and durable medical equipment processor orthosis fees schedule to reflect expanded medical assistance coverage for both orthotic and prosthetic L codes for the purposes of whole body health and limb function. So it's making it sound like this is covered already, or it's not. Why are we having a discrepancy between what MDH thinks and what the bill proposes?
Certainly, I can speak to that. So we believe that the discrepancy lays is the billing codes, the L codes for these custom orthotic devices are already codes that are covered and billed for with orthoses that these patients receive as like their everyday devices. So these are not new billing codes. This is just clarifying the existing benefit for orthotic devices. Essentially, with these custom orthoses that are being provided, the design and the coding is different than that of their everyday devices, but these aren't like new devices. These are just a different design as to what these individuals need for their daily walking.
Okay, because notwithstanding, obviously, the need for it, and I think we've all agreed to this, and we passed legislation previously. I just was wondering why MDH came through, and so you think it's a little bit more clarifying than anything else?
Yeah, so it's clarifying the existing essential health benefit. And so again, the codes that Medicaid and the other payers, including the commercial insurances, they're already paying for these codes. They're just only paying for it for an everyday device. They're not paying for it for a device when the medical necessity is specifically to increase that individual's ability to participate in physical activity.
Okay, so that's a little bit different than everyday device.
Yes.
And I guess that's what your bill was for 2 years or last year. All right, well, I appreciate the explanation.
Absolutely. Thank you for your
very much.
question.
Thank you, Mr. Chair.
Thank you. Are there any additional questions from committee members? Nope. Seeing none, thank you all so very much. We do have a couple of people that signed up. Well, is Charlie Kelly here? Okay. All right. Well, come on up, Charlie. And there's going to be a couple of people that follow behind Charlie who will virtually testify.
Chair, Vice Chair, and members of the Maryland State Finance Committee. My name is Charlie Kelly, and I'm a certified orthotist and prosthetist practicing in Annapolis. I'm here in strong support of SB 276. Orthoses are not nice to haves. They are medically prescribed devices that protect joints, stabilize weak or misaligned limbs, reduce fall, and prevent secondary complications. In my clinical practice, I see orthoses function as lifelines for people managing neuromuscular and musculoskeletal disorders and acquired conditions, because without them, mobility and independence can disappear quickly. The purpose of SB 276 is to expand the current law to include coverage for activity-specific orthoses when they're medically necessary. This matters because activity-specific does not mean recreational. It means clinically appropriate for the real-world demands of rehabilitation and function. A single everyday brace cannot safely meet every medical demand placed on the body. The forces, speed, balance, reaction, sweat, and water exposure, and range of motion needs are different when somebody is doing therapy-based cycling, aquatic therapy, strengthening, or higher level gait training. When a patient are forced to a one brace for everything approach, they often compensate, overuse other joints, develop skin breakdown, or just stop doing the very activities their care team has prescribed for their therapies. SB 276 clarifies that covered orthoses include all orthoses a treating provider determines are medically necessary to complete activities of daily living, essential job-related training, or perform physical activities, including running, biking, swimming, and strength training. Here's what it looks like in a real patient's life. One of my 9-year-old patients has an inoperable brain tumor. He has developed hemiparesis, and his therapy isn't about walking better. It's about keeping his brain engaged and fighting its functional decline. He has been playing a violin as part of the rehabilitation plan that stimulates the affected areas of his brain in coordination with his motor learning. For him, it's not optional, it's treatment. It's the difference between being shut out of therapy and being able to participate in it. Thank you.
Yeah, any questions? Nope, seeing none. Thank you so much for your testimony, Mr. Kelly. Appreciate it. Next, we have some virtual witnesses. Is that Rachel? All right. Rachel, you may begin whenever you're ready. You're on mute.
Thank you, esteemed members of the Maryland State Finance Committee, for your time and attention. My name is Rachel Piggott. I'm an occupational therapist and certified hand therapist that works at Johns Hopkins. Today, I'm representing the Maryland Occupational Therapy Association during my testimony related to Senate Bill 276. I have fabricated and worked with people with upper limb injuries and dysfunctions as part of my practice for 26 years. Orthoses help to promote healing by holding precise anatomical positions. And then they also can facilitate, as some of the previous presenters discussed, effective early rehabilitation. Many times, the proper alignment of the joint allows for us to progress the patient and to be able to achieve maximum function. And this helps people return to their ADLs or activities of daily living, like bathing and dressing. IADLs, which are more complex, such as meal preparation or household maintenance, work tasks, or even leisure activities and sport activities, depending on what roles they engage in. When people lack access to these orthotics, it doesn't allow early rehabilitation. Their recovery can be delayed, and their outcomes may not be as good. Orthoses are also essential for chronic conditions such as arthritis or hypermobility. They support the joint in proper alignment so people can perform everyday tasks like opening containers, using tools at work, or caring for an infant without pain. This legislation supports equity and health and ensures Marylanders can access services that help restore function most effectively and engage in roles important to them, like parent, worker, athlete, student, or caregiver. I would just like to say on a side, there's many instances that I can say that my patients don't have access to the orthotics that they need, and then it can slow their recovery and limit their ultimate functional outcome. I recognize that virtual testimony is not ideal, but I needed to testify between patient appointments, and I'm deeply committed to this issue. I hope you'll support this legislation. Thank you.
Thank you so very much for your testimony. Next, Amanda Mummert.
Hello, thank you. My name is Amanda Mummert, and I'm the Executive Director of the Down Syndrome Association of Maryland. So I'm here on behalf of the Maryland Down Syndrome Advocacy Coalition, or MDAC. It's a coalition of the 5 Down syndrome organizations in Maryland and individuals with Down syndrome and their family. We've come together to advocate for improved quality of life. So MDAC strongly supports SB 276, which, as you know, require the coverage of activity-specific orthoses. These are medically necessary devices for our community. They support alignment, improve function, and relieve symptoms of musculoskeletal conditions. This bill is aligned with one of our guiding principles that people with Down syndrome need equitable, high quality, and affordable health care. We know that orthotic devices impact mobility, participation, and quality of life for people with Down syndrome. They often experience low muscle tone, ligament laxity, and foot deformities like flat feet. These characteristics can impair their gait, their balance, their endurance, and physical activity across their lives. Despite clear medical value, orthotics are not covered or not covered well enough by insurance. And as a result, our families are forced to pay significant out-of-pocket costs. One family recently shared with me that their adult loved one who has Down syndrome needs orthotics twice a year because they wear out. And this is $1,000 out of pocket for them each year in addition to everything else. So this bill would remove the financial barriers and ensure equitable access to medically necessary orthotics for Marylanders, and Marylanders who rely on the devices to move, to work, and to participate fully in their communities. Thank you. Thank you for your time.
Thank you. Thank you for your testimony. Next, we're going to hear from Richard Block. Richard, you're on mute. You may begin when you're ready.
Right. Good afternoon. My name is Richard Block. I'm the Executive Director and General Counsel of the Maryland Podiatric Medical Association. You heard a lot of the reasons why we would be strongly in support of this bill from the other speakers. Orthotics in the field of podiatry provides a profound impact on everyday lives of the patients. These custom-made orthoses provide patients with the ability to maintain a high quality of relief in their lower extremities, as a result, decreasing abnormal forces that transfer through the limbs. Orthotics have been shown to be beneficial in a variety of activities, such as rigorous job environments, wide range of sports, and everyday life. In some situations, providing patients with an activity-specific device is necessary to be tailored to their needs to better the health and overall well-being. You've heard many examples in the testimony before me, and we are in strong support of this bill with the amendment we've suggested to add the language of neuromuscular, musculoskeletal, acquired or congenital conditions to be more inclusive for these people who need these on a regular basis. Thank you very much, and we urge you to support this bill.
Excellent. Thank you for your testimony. Are there any questions? Seeing none, thank you so very much. This ends the testimony on Senate Bill 276. Turning it back over to you, Madam Chair.
Thank you, Mr. Vice Chair. So our third bill for the day is Senate Bill 95, Senator Ellis, Property and Casualty Insurance Parametric Insurance Regulations.
Thank you so much, Chair Vital, Vice Chair Hayes, and member of the Senate Finance Committee. Right now, I'll discuss Senate Bill 95, parametric insurance. And you can go ahead and ask me, what is parametric insurance? Everyone else does. And I'll put on my professor hat right now and bring back those days from years past where I will bring a very new product to Maryland. Well, let me start with a story. Last year, late spring, I believe, there were some heavy rains in western Maryland, caused a lot of flooding. I think over $34 million in damage to our western Maryland communities. When Governor Moore requested FEMA assistance, it was denied. The Trump administration said, we are not in the FEMA business anymore. We will not declare an emergency and we will not give you a payout. Well, the governor appealed that decision, and months later, the Trump administration came back and said, we were serious the first time. We will not pay for that damage. Folks in western Maryland, including the Republican member of Congress, said, hey, that's a Republican area. We know you don't like Maryland because they're Democrats. That's a Republican area. All Republican representatives in western Maryland, that area damage. And the Trump administration came back and said, we told you we're not going to pay. And go away. And that was the final decision. And this year's budget, the governor put millions, I think $12 million on the budget to cover some of that damage. So basically, that money is coming out of our operating budget to pay for some, if not most, of the damage in western Maryland. So the state pays quite a bit of money for me to go to these conferences every year. Some wonky conferences, one called NCQUL, National Conference of Insurance Legislators. And I pay attention, go to the seminars, and learn a thing or two about what other states and countries are doing, and discover this product that's out there called parametric insurance. The insurance is based on damage caused by a specific event. For instance, you'll say, hey, I want to buy insurance to cover hurricane damage in, I'll use my home nation of Jamaica. If you have 125 miles per hour winds over a sustained period of time, we know it's going to cause damage. So you know what? We'll pay out X number of dollars based on your policy. So I bring up that story to say that Jamaica bought this parametric insurance policy that was in effect when this last hurricane hit. And according to the World Bank website, it says Hurricane Melissa triggers 100% payout of $150 million. $150 million within, I think they said, 14 days of that natural disaster. 14 days. It took us maybe 7 months for the Trump administration to give us the final no, we will not cover. Here, this product, an insurance product that a third world country bought, paid out within 14 days $150 million to cover disaster financing based on the parametric insurance they produce. It's a product that works. Other states in the U.S. are using it. It is a relatively new product, and it's new to Maryland. And if you look at the testimony, colleagues, you'll see that some of the folks, American Property Casualty Insurance Company, came in unfavorable. If you look on your colleague on the laptop in the testimony. And if you click on the first one, talking about parametric insurance overview, and this is really exciting reading for your free time, it talks about parametric insurance. Why it's critical to have insurance. It's a wonderful, wonderful, very detailed example of parametric insurance that they talked about in their testimony. It says it's under a traditional insurance policy. If a loss occurs, the claim is adjusted, your insurance person comes out, and they base that claim based on their loss. On a traditional policy. Under a parametric policy, customers select or negotiate triggers like that 125 miles an hour wind. So triggers like wind speed, proximity to fire, rainfall, choose payment amount when the policy is triggered, how much you want to pay out with this insurance policy. And then, of course, you pay a premium, which is covered by a large group of folks, so the payment premium is very much affordable. Even a third world country can afford it and has bought it and collected $150 million from that policy. Now, what did Maryland collect from our coverage with FEMA? Zero. Okay. We can do better than a third world country. I love Jamaica, but they have struggles. But they bought it, they have foresight, and they got paid $150 million. And this testimony on your laptop, it also talks about emerging parametric market, complementary rather than replace. It fills gaps in coverage, and it's increasingly popular. And considerations for parametric benefits, both for the customer and for the insured. And it just is wonderful examples that coverage could be bought for earthquakes, hurricanes and tropical storms, floods, hail, wildfires. And I think we've had all these in Maryland. We had flooding, of course, in Ellicott City, Western Maryland. You all remember that earthquake maybe 10, 12 years ago that ripped through, especially hard felt, in the DMV, the Montgomery County, Prince George's area, that caused a lot of damage, including to the National Cathedral. Took years to fix. Tropical storms, you can buy it for tornadoes. We had tornadoes touch down in my hometown of Charles County. La Plata destroyed lots of government buildings. Okay, wildfires, hail. You can buy this insurance for many, many coverages and many purposes. But please go ahead and look at that handout that these folks who don't like the bill gave us. It's amazing. The dislike, the unfavorable, is based on, hey, we don't understand this product. I understand it's a new product, but we desperately need this coverage. It's not something that's new to the world. It's new to Maryland. And I think it's required a thought to authorize, this is bill, authorize the state to pay for this coverage. And now I have a lot of discussions with the Maryland Insurance Administration. Commissioner Grant, her agency gave a wonderful letter of information in your package. And generally, it's supportive and things that they will help us work on as we go to mark up this bill. I believe it's a product that Maryland needs because we cannot count on the Trump administration to help us in, of course, the past damage from last year's flooding and any future disaster that could or will eventually happen in Maryland. Parametric insurance, that is the new product that Maryland should take advantage of. And colleagues, I ask for a favorable report on Senate Bill 95 to authorize the state to pursue this level of coverage so we don't have to dip into our operating funds to pay for the next disaster. Thank you.
I was just reading the MIA letter. Any questions at all for Senator? You have a question for Senator Ernst?
Yes, thank you, Madam Chair. I just got finished reading the MIA letter, and in addition to your testimony, thank you so much for explaining, because I was like, what is parametric insurance? And it's interesting. You said other states have it, but I didn't see that in your testimony. You know what states are already deploying parametric insurance?
Yeah, I think, let me not
if you
say the wrong thing.
Just get it to the committee.
I'll give it to the committee, yes. It's someplace in all this notes right here, and I'll get it to the committee.
Yeah, I'd just like to get a chance to see like how extensive it's used across the rest of the country. So thank you so very much. Thank you.
Sure, you're welcome.
Thank you, Mr. Vice Chair. The part I was reading when I was distracted, it's important to note that parametric insurance is likely already sold in Maryland, either as an approved product or on the surplus lines market. It is viewed as a product that is supplemental to other types of comprehensive insurance products for homeowners, businesses, and government. Senate Bill 95 would establish a framework for further regulation of parametric insurance. So I find that interesting because, we have some opposition from insurance companies. So,
Yes.
But our insurance commissioner offers up some amendments that we can talk about. So
Yes.
thank you. Thank you, Senator.
Yeah, thank you, Madam Chair. Done with me? Okay, thanks.
That ends our sponsor's testimony. We have one in opposition, Robert Enton.
Thank you very much, Madam Chair. Robert Enton on behalf of the American Property Casualty Insurers Association. And you may think it's odd, why would the insurance companies be opposed to this legislation? We are not opposed in any way to the notion of furthering this type of insurance. It is available as a surplus line product, and as the chair knows, surplus lines are regulated in a much different fashion than traditional insurance. You have the written testimony of our association, and the primary concern that we have is that this bill becomes effective, I think, either July 1, and says there should be a pilot program, but at the same time establishes the program without any kind of pilot. We're not opposed to the notion of this kind of insurance, but what I discussed with the sponsor was we would strongly support amending the bill to require the MIA to do a study, to have a work group on this product, and then come back with recommendations as to how this program should be implemented. There's not one word anywhere in existing Maryland law about parametric insurance. And in fact, when you look at the MIA's written testimony, they say that, this is at the bottom of the first page, only one state, New York, has passed a law to establish requirements and mandate disclosures that specifically apply to parametric insurance. This is a much, much different type of insurance than anything that's out there. It's not widespread in Maryland. It's mostly bought by large commercial companies where they say, okay, I'm going to pay this amount, and you, the carrier, you'll pay that amount, and we don't have to furnish proof of damage to get those funds. That's why it's unlike any other insurance policy that's out there. So what we would urge the committee to do would be to amend the bill, mandate a study, and let's come back next year with a statutory framework for the sale of this insurance. Thank you.
Thank you, Mr. Enton. Senator Hayes.
Yeah, thank you, Madam Chair. Bob, always glad to see you here in the committee. Your testimony didn't match your sign up on the sign up sheet. You guys signed up as unfavorable, but it sounds like you guys are amenable to it, but with some amendments,
yes,
it could happen, right?
So I hand deliver to each of you today, at the suggestion of the sponsor, a letter which basically says that. And I walked around and gave it to everybody at about 12 o'clock.
No.
We're not against having parametric insurance, be more widespread in this state. But it is a different kind of a totally different product because what you pay out is not based on the amount of damage. Right now, you can get it as a surplus line. If you expanded it so it would cover the types of damages that the sponsor is talking about, great. We just think that what needs to happen is before we put it into effect in the manner that's in this bill, that we need to have the MIA take a hard look at it, and let's come back next year with a comprehensive statute that regulates and sets forth the requirements and standards for the issuance of parametric insurance, just like we do for other types of insurance. And if you look at Ms. Egan's written testimony, she points out, I think, a number of more drafting issues with the bill that would also something that should be the subject of study, so we come back with a bill next year that everybody can support.
No, I appreciate that. And if you could tell us in the most lamest terms, not as long as your answer was, but as short as possible, like what is the supplemental insurance that you referred to? Like, what, you said that this is.
The surplus. This is
Right, surplus, I'm sorry. surplus.
So if you look in the Maryland, in the Maryland Code, in the insurance article, you'll see in subtitle 3 of the insurance article, there's, I don't know, a whole bunch of different sections that talk about surplus lines. And what is a surplus line? Surplus lines can only be sold by licensed surplus brokers, not just regular insurance brokers. And what surplus lines do, and I'm not an expert in this, believe me, but my understanding is that what surplus lines are there for is to address kinds of damages and kinds of insurance that traditional insurance companies are not writing. And it's called a surplus line. Now, Ms. Sexton is here today from the MIA. I've talked to her about it. And, surplus lines are just not regulated in the kind of detail that non-surplus lines are.
The sponsor has a question. Senator?
Yeah, thank you, Madam Chair. So I'm happy to know that, Mr. Vice Chair, your question was answered about which state have it, New York. So thank you for that. So that's one less research point for me later. And also, thank you for reaching out to me today and previously to kind of, basically get your softening of your opposition, I said, basically you could, always talk to me, right? This is a product that is working for others around the world and serving their need. So the question is, could you and your clients up your attention to this matter? So before, the crossover date, get your position. Because can we afford to wait another year with the potential for natural disaster to happen? It's not if, but when the next natural disaster will affect us. When the federal government, Bob, is not helping us in so many of these claims, is it possible for your folks to work with us and work with the Insurance Administration to really get something on the books so we can look at authorizing the state to get this coverage?
In all honesty, I would say to you that I think the problem is that if we're going to put this product out there for Maryland citizens, we need to have the same kind. I haven't looked at the New York law, and I'm happy to look at it. But we need to have a detailed regulatory framework, and I just don't know if we're going to come up with one in the next 10 weeks. That's why I'm suggesting that you all amend the bill, turn it into a study, mandate a report back to you, and we'll work it out over the next 4, 5, 6 months and come back with the bill.
So understand. And so the question is, this body, we're not regulators, we're policymakers, right? So if we put the bill authorizing the state to have the policy to work out the regulations, that's usually how it works. So, we don't do regulations. The executive branch agency do the regulations. Is that correct?
Yeah, but look, there's the statute and there are regulations to clarify how the statute's going to operate, but it's still regulations are subordinate to what the law is that you pass. You go look at the regulation of property casualty insurance in the Maryland Code today. It goes on for pages and pages and pages and pages and pages. Same thing for health insurance, pages and pages and pages. All I'm saying is we'd love to see this product expand, but we need to make sure we're doing it in the right framework. That's all.
Okay, and hopefully in a timely manner. Thank you, Madam Chair.
Thank you, Senator Ellis. That ends the hearing on Senate Bill 95. And I'm sure that Mr. Hunton's very grateful to our manager, Tammy Kraft, for allowing you to testify today.
Thank you.
Senate Bill, next we have Senator Ellis, Senate Bill 120, Health Insurance, Required Benefits for Dental Preventative Care, Frequency Limitation Interval, and its Healthy Moms and Family Smiles Act. Thank you, Senator. Do you want to bring up your panel?
Yes, Madam
Charles
Chair.
Doring and Dan Daugherty.
Good afternoon again, Chair Bottle, Vice Chair Hayes, and distinguished members of the Senate Finance Committee. Arthur Ellis, District 28, Senator, to present Senate Bill 120, Required Benefits for Dental Preventive Care Frequency Limitation Interval, AKA Healthy Moms and Family Smiles Act. Senate Bill 120 modernizes Maryland's dental preventive care standards by reducing the maximum interval between covered preventive dental visits from 120 days to 90 days for healthcare carriers. This adjustment is intentional and evidence-based. It allows for more timely access to routine checkups, cleanings, and other preventive services, care that is critical to identifying oral health issues early before they become more costly and more complex to treat. The bill is particularly impactful for pregnant and postpartum mothers whose oral health is directly linked to birth outcomes and overall maternal health. It also supports children's oral development by promoting oral health development by promoting consistent preventive care during critical developmental stages. What's the impact? By reducing restrictive visit intervals, Senate Bill 120 improves access to preventive dental care, helps address oral health deficiencies before they escalate, and reinforce prevention as a cost-effective component of overall health care. This bill will not cost the state anything, zero fiscal impact. This bill will not cost insurance companies any additional monies. As a matter of fact, it might actually make them additional money because this bill, in the weeds, authorizes the insurance companies, require them actually, to offer tiered coverage and dental coverage policies in Maryland. Right now, Maryland does not have a restriction on the limitations on how many times folks can visit the dentist. So a lot of insurance policies in the state of Maryland give you one visit per year for routine cleaning. One visit per year when dentists recommend at least 2 dental cleanings per year. This bill would require insurance companies to price their policy based on the number of coverages they offer, number of visits to the dentist they offer. So if it's 1 visit per year, it's priced a certain way. If you buy a policy that has 2 visits per year, it's priced accordingly by the actuaries. If it's 3 visits, or some recommend for mothers and postpartum, or 4 visits per year, it's priced accordingly. You can buy that policy. And so you might ask, well, why don't they just pay the money and go to the dentist for those extra visits? Well, if you just pay out of pocket, you are subject to the market price, right? But if you have the insurance company who say, even though you authorize X number of visits, you will pay the negotiated rate. And so having this coverage to buy this rate will cost so much less for families to really get the dental care they need, especially moms and their young babies who really are affected by the deficiencies. So folks always ask me, how did you come up with this idea for this bill? Well, I went to my dentist. I was waiting on the waiting for the hygienist to come in to the room. So I'm just reading everything on the walls. And there was a poster talking about the importance of dental care for expectant moms to maintain their teeth and for healthy babies. I'm like, really? That's connected? I had no clue. So I started spoke to my dentist when she came in. I spoke to other folks in the field. And they said, yes, it's very important for expectant moms and postpartum to get dental care. Because one thing babies do, I mean, they bring a lot of joy, right, to us, but they also suck the life out of the mother. Basically, calcium goes out of the moms into the babies for their growth and development. You know, I won't be like Dr. Lamb, I can't go into the specifics of it, but, you know, it's a heavy toll on a mom's body, and it's a very heroic work that you do, basically delivering a healthy baby. And so basically, the baby drawing all those nutrients from the mom, you know, it could leave the mom in a very deficient manner when it comes to her own health care. So dental care is a very important part of this entire process to really improve maternal health care and child outcomes in Maryland. Therefore, colleagues, I hope and ask for a favorable report on Senate Bill 120.
Thank you, Senator. Who wants to go next? Dr. Doring?
Thank you, Madam Chair, Mr. Vice Chair, members of the Senate Finance Committee. My name is Charles Doring. I'm a general dentist in Rockville, Maryland. I'm also a Maryland Healthy Smiles Medicaid provider, and I'm do portable dentistry in long-term care facilities and those that are homebound, as well as the current president of the Maryland State Dental Association, the state branch of the American Dental Association. I thank Senator Ellis for bringing this to everyone's attention. And I've submitted written testimony, and in there lists high-risk groups. The 6-month checkup is really out the window now. It's an evaluation of each individual patient and risks. And it's a discussion between the patient and the provider, dental hygienist, dentist, to come up with a system that works to minimize oral disease. And I have a colleague, Dr. Farquharson, who teaches, he's a professor at the Howard University College of Dentistry, and he made a profound statement to me when we were discussing the other day. He says, life starts and ends with the oral cavity. If you think about it, little babies must have nutrition to thrive and survive. And then you look at the other end of the spectrum, our elderly. Short of a feeding tube, if they do not ingest and able to chew their food, life will come to a closure. So in my testimony written, I actually presented a report in here from Cigna. And as Senator Ellis stated, insurance companies will decrease expense overall for dental care and for overall medical care as well. So I invite you to read that. For these reasons, I ask for your support in Senate Bill 120. Thank you.
Thank you, Madam Chair, Mr. Vice Chair, members of the committee. I'm Dan Doherty. I'm here representing the Maryland State Dental Association. Excuse me. I'm going to say me too to what Dr. Doring said. I would add, though, that when there is coverage and it's for 2 times a year for certain types of preventive care, often the individual, sometimes particularly the elderly or those who are only partially employed, they want to pick and choose at what time the insurance company covers it because they don't have the money at that point in time to pay out of pocket. And there are those individuals who require 4 times or more a year for a particular prophylactic treatment. So with that, I would offer my services to the committee as a portal for information, and please feel free to contact me. I urge a favorable report, and I thank you for your time.
Thank you, Dan. Do I have any questions? I don't. Oh, Senator Lamb.
Yeah, thank you, Madam Chair. Thank you to the panel, the bill sponsor. Just a follow-up question. I was looking through some of the testimony here, and some of the testimony seems to point to the fact that, you know, for clinicians, for providers, for dentists, it'd be helpful to have some flexibility here, that you really want to tailor the preventive visits to the individual. So in this instance, why did you draw the line at 90 days then versus just giving the provider kind of deference to this? Obviously, this is probably a compromise of some sort, but can you walk us through that thought process?
Lamb, I have some elderly patients that swear they have an electric toothbrush. I say, please bring it in. I have them on a 2-month recall because I'm trying to maximize their oral health that's going to help them in their systemic health. I think it's written in this way, and it's, you know, trying to reach a compromise. But I think ideally to not have any limits and let the practitioner and the patient decide is the best course.
Okay. All right. So this was basically just kind of a meeting in the middle, better than 120 days, not as much flexibility, just completely deferring to the provider then, correct?
We've had some cases when, under the old law, when a patient came in, say they were a college student, and they came in at 5 months and 29 days, and they're heading off to college, and the insurance company would deny benefits because of that. Fortunately, we've changed it to the 120 days, but the need's still there.
Mm-hmm. And then last question, is there a scenario where a visit would not include preventive cleaning when it's indicated? Like, can you envision any type of scenario like that?
On frequent recare, if a patient comes in and they're healthy, we'll say, wow, congratulations, you get a gold star. We'll see you in X 6 months or whatever the recall. And in my testimony, I have patients that are marathon runners, real health conscious. And I'll say, I'll see you in a year, I'll see you in 18 months. It has to be customized to what the patient's oral condition is.
Okay. All right, thank you.
Thank you, Senator. Seeing no other questions, that ends the hearing on Senate Bill 120. No, I'm
Thank
sorry.
you.
I'm wrong. We have two favorable with amendments. So, Michael Patty and Robin Elliott.
You'll have to suffer with just me. Michael is across the street, so thank you so much.
I think we can manage that, Robin. Thank you.
So Robin Elliott, here today on behalf of the Maryland Dental Action Coalition, very much in support of this bill. We wrote down support with amendment. We just wanted to essentially provide some food for thought. We very much support the idea that cleanings and other preventative services perhaps should be more frequent than every 6 months. We see every 3 months a lot in the literature, but it could be adjusted based on the patient's risk level. We just wanted to point out that the statute itself doesn't actually require a minimum number of visits. It only points to the frequency. So if the sponsor and the committee wanted to establish what the preventative services were and how frequently, there would have to be an additional amendment. So it's a little convoluted when you read that law.
Robin, does your testimony have something in writing for us to look at for an amendment?
I did not write the amendment yet. I would be happy to. My plan was to work with the sponsor on it.
Thank you. Thank you, Senator Lamb.
Just a follow-up question. So the suggestion here from the Dental Action Network might be to state a particular frequency in the statute? Is that?
So the statute has the frequency, but it doesn't actually have, it has that the services should be covered. They should not put a limit of more than 120 days between services. What the statute doesn't actually have is that 2 visits a year are required, or 2 visits plus more if you're high risk.
Right, a minimum number of visits per circumstance of that patient, I guess.
Right. So if that is the direction that the sponsor and the committee want to go, just we wanted to lift up, that would need an amendment. And happy to work with Senator Ellis on that in the committee.
Okay. All right. Thank you.
Thank you, Senator Lamb. Now that ends the hearing for Senate Bill 120. We're going to skip just for a minute. Senator Guile has someone testifying that needs to be finished before 2:45. So Senator Guile, Senate Bill 272, Health Insurance Scalp Cooling Systems Required Coverage. And I think you're going to bring a panel. Rosalind Ripper, Melissa Borstum, Kara Franklin. Dr. Goldstein's going to be virtual. Kathy Elder and Sarah Campbell.
Thank you, Madam Chair. For the record, Senator Dawn Guile from District 33 here to present Senate Bill 272. This bill requires insurance carriers that cover, that cover chemotherapy to also cover FDA-approved scalp cooling systems used to prevent or reduce hair loss during chemotherapy treatment. Maryland law already recognizes that cancer treatment involves more than chemotherapy alone. State law requires coverage for chemotherapy itself, for fertility preservation when medically necessary due to chemotherapy, and for a hair prosthesis following cancer treatment. Scalp cooling serves a similar supportive care function, yet it remains largely uncovered and accessible only to patients who can afford significant out-of-pocket costs. In fact, these scalp cooling caps, we're going to hear from some experts on this, can cost anywhere between $1,000 to $2,000 or more. I recently, one of my dear friends, from childhood. Her mom passed away from breast cancer when we were in 8th grade. She's currently undergoing cancer treatment, had 24 chemotherapy infusions, just finished a couple weeks of radiation. And I asked her when I was doing this bill if she had considered to retain her hair to get one of these scalp cooling caps. And she said that she hadn't even thought about it because she knew she couldn't afford it and she knew it wasn't covered. Scalp cooling is not experimental. FDA-approved scalp cooling systems are in use at major cancer centers in Maryland and are supported by clinical evidence and national treatment guidelines as an appropriate supportive care option for certain patients undergoing chemotherapy. In fact, there's a letter in your bill packet that indicates that they can be upwards of 80% effective of reducing or eliminating hair loss when receiving chemo treatment. This bill is deliberately narrow. It applies only when chemotherapy is covered, only to FDA-approved systems, and only prospectively. It does not apply to self-insured plans or public programs, although I would note that I was just reading that Medicare just started covering these beginning January 1st of this year. And it preserves provider discretion regarding when scalp cooling is clinically appropriate. In addition, the Maryland Healthcare Commission has already evaluated required coverage for scalp cooling and found that the estimated impact on premiums would be minimal. I think if you see the letter in the bill file, it was between 0% and 0.05% impact on premium costs, even under high utilization assumptions. You will hear today from patients and clinicians who can speak to how this therapy affects quality of life, mental health, and treatment adherence. In fact, there are oftentimes women who may decide not to get chemo treatment or may try to do less effective treatment for fear of losing their hair. This bill ensures that access to supportive cancer care is determined by medical judgment, not a patient's ability to pay. At its core, however, this bill is built around protecting human dignity and fostering empowerment. I am honored to have such a passionate group of advocates here today to help convey that message to this committee. And with that, Madam Chair and colleagues, I respectfully request a favorable report on Senate Bill 272. I'd also add that other states now have also passed this required coverage. So,
Senator, thank you for your testimony. I'm going to ask Dr. Goldstein, who's our virtual, to go next so he can go back to caring for his patients.
Yeah,
so,
thank you, Madam Chair.
Dr. Goldstein, if you unmute, we'll hear your testimony now.
Hi, thank you so much. So I'm Dr. Mark Goldstein. I'm an oncologist. Started my training for oncology in 2005, and I have been practicing in Maryland since 2008, since I got out of training. So I'm currently the president of the State Oncology Society called Medesco as of January 2025 as well. And myself and the board members and many other practitioners that I know are very much in favor of this type of legislation. I won't get into too many statistics, but there may be as many 5,000 women diagnosed with breast cancer in Maryland every year. And certainly not everyone needs chemotherapy, but a lot of people do. The scalp cooling technique, it's actually been around for decades. I've known nurses who've known about this probably since when I was born. They were tinkering with it, but the technology is so much more advanced now. The methodology is better, and it can help. And when you consider the different severities of hair loss, and what we're talking about here is preventing or minimizing hair loss. At least 53% or so of patients who use the scalp cooling when receiving chemotherapy for breast cancer can have excellent results. What's not well known is that since 2018, the technology has been approved for other cancer types as well: ovarian cancer, prostate cancer, and a couple other ones. So it's not restricted to just patients with breast cancer, which means we can serve a lot more patients than I think we would normally appreciate. My own daughter was diagnosed with cancer just over a year ago, and 20 years old, and lost all of her hair. And I can tell you the psychological impact was enormous. For patients trying to effectively live their lives, because now a lot of patients can be treated, managed outpatient, even though they're on chemotherapy, there is a clear psychosocial and social, and sometimes even financial impact not being able to go to work the way patients would want to do, questions, personal questions, what's going on with you, things like that. And the impact is well beyond just the financial impact that we're talking about today, which is the insurance piece of it. You did comment about other states. To my knowledge, there's only one other state who's ever passed such legislation, and that's New York. And they passed it last year, and it became effective January 1st of this year. So if we were to pass this, we would be the second state in the country, to my knowledge, to have such legislation. So I think this is extremely important for patients' mental health, which is already greatly impacted by the diagnosis and things that patients have to go through. And I 100% support this bill.
Dr. Goldstein, thank you for your testimony. Thank you for taking the time today to testify with us. Do I have any questions for the doctor? Because I think he's going to go back to work. Thank you very much.
Okay.
Senator Powell, who would like to go next on your panel?
Do you want to go next, Kara?
Good afternoon, Chair Beidel, Vice Chair Hayes, and members of the Finance Committee. My name is Kara Franklin, and today I'm here not as Delegate Patterson's Chief of Staff, but I'm here as someone who went through treatment for breast cancer. So if you notice, I didn't use the term survivor. It's not a term that I like to use because survivor indicates that something ended. And for some of us, it's not over. For most of us, that experience is still ongoing. It doesn't stop when your treatment ends. So it's with you every blood draw. It's with you every scan you have. It's with you every odd headache that you get and every unusual ache that you have in a bone. It's there and you're thinking about it. So while I did not have to undergo chemotherapy, and you will hear from a panel of folks who can attest to how well the cold cap worked for them, I did not have to undergo chemotherapy. But quite honestly, my testimony is pretty important simply because this is for me. If my cancer comes back, it will be stage 4. At which time I will then likely have to have a regimen of chemotherapy, among other things. So while a lot of these folks you're going to hear from have already undergone treatment and could have benefited from it, you're helping those of us who may need it again or may need it in the future. So I'll let folks talk about the hair loss, cosmetic, how important that is to somebody who's undergoing treatment, because it just gives you a sense of normalcy. You're no longer the person in treatment. People don't look at you and know that you're going through something that's significant. You'll hear the fiscal standpoint that the cost is not significant enough that I think you all should consider supporting emotional and mental health before the financial aspect of it. But thank you to Senator Guile and Delegate Nakongolo for introducing this legislation, and I hope that you'll stand with states who are already doing this.
And I would just add real quickly, Madam Chair, I know the doctor said it was just New York, Louisiana has passed it too, in addition to Medicare implementing it.
Good afternoon. My name is Amy Tanner, and to allow women to have a choice in trying, excuse me, it's been a long road. To allow women a choice to save their hair was my idea. I took the idea to Delegate Nangolo and testified last year, bald head and all. I am a 48-year-old mother of 4. I was diagnosed. Sorry. With triple-negative breast cancer in November of 2024. Had scalp cooling been covered by insurance and gone towards my deductible, I would have done it. I went through trial chemo and had residual cancer after surgery, so then I had to do more chemo. 21 rounds in total. Chemo takes your hair, your breasts, your identity, your self-esteem, your mental capacity, your social life, and sadly, some of your friends. I lost my hair again after it just started growing back. My journey was tough, but I'm tougher. I finally finished treatment in December of 2025 and completed all surgeries before the year was up. My hair is finally growing back. My sadness now lies in the fact that my son is getting married this summer, and to have had hair in my pictures, my hair, would have made all the difference in the world. Pictures are forever. I have good wigs. I can go from George Costanza to Dolly Parton in a matter of minutes. But my hair was better. Let's do for women what New York and Louisiana have already done. Let them have a choice.
Hi, my name's Laura Del Borel, and actually Amy and I have known each other since middle school, and she has really encouraged me to speak out today. I was diagnosed with stage 3, grade 3, triple negative, and estrogen receptor positive breast cancer back in August. This is my first time facing cancer, and I'm currently still going through chemotherapy and have a very long journey filled with surgeries, radiations, and scans ahead of me. Like many patients, I began treatment extremely overwhelmed, trying to process a diagnosis I never expected while continuing to show up every day as a mother to my 2 daughters and a wife to my husband. Shortly after my diagnosis, I was informed about cold capping, a method showed to significantly reduce hair loss during chemotherapy. However, I was then informed of the cost. Because insurance does not cover cold capping, the cost, upwards of $3,000, made it inaccessible to me, as it does for so many patients. It's unfortunate because I do feel that cold capping could have helped preserve a sense of normalcy and emotional stability for me and my family during my treatment. I can't begin to explain the sadness and shock I felt when clumps of my hair began falling out, even though I felt like I was fully prepared for it. I'm a nurse. I've been a nurse for 24 years, and I thought I was stronger until that day. Chemotherapy takes so much from a person: time, energy, a sense of normalcy. Hair loss due to chemotherapy is often described as cosmetic, but for patients in treatment, it is deeply personal and emotional. It's the moment when illness becomes public, when strangers know your diagnosis before you've chosen to share it. Losing my hair has meant losing confidence and control at a time when so much has already been taken away from me. It has meant my daughters watching their mother physically change in ways I cannot shield them from. In addition, I feel like I have lost a sense of femininity and self-expression. Seeing my bald head every day is a constant reminder of the chokehold this disease has on me. Patients should not have to choose between financial strain and emotional well-being while fighting cancer. Insurance coverage for cold capping is a compassionate, common-sense step towards more comprehensive cancer care. Insurance already covers other appearance-related cancer needs, such as breast reconstruction, wigs, and prosthetics. Cold capping fits squarely within the same category of medically necessary quality of life care. I respectfully asked Maryland lawmakers to pass SB 272 so cancer patients across our state can receive more compassionate, comprehensive care. Thank you for your time and consideration.
Thank you. Go ahead.
Good afternoon, Senator Guile, Madam Chair, Chairman, Mr. Vice Chair, and Senate Finance Committee members. My name is Rosalind Abbott-Ripper, and although currently still in active treatment for HER2-positive breast cancer, I successfully completed 3 months of chemotherapy in May of 2025. Through scalp cooling, I was able to keep all of my hair. I've spent the last year advocating for Marylanders to have access to scalp cooling and have it covered by insurance. I'm testifying in person and in writing in favor of Maryland SB 0276. spoken to. Receiving a breast cancer diagnosis is a life-altering event. My initial thoughts were wondering if I was strong enough mentally and physically to get through cancer, if I could afford it, because even with health insurance, a cancer diagnosis is a financial burden. I worried about how I would maintain normalcy at my job and for my son. The most painful reality was that I was going to lose my hair. I was completely devastated. I learned that I would be a candidate for scalp cooling based on my chemo regimen. I would have a chance to keep my hair. I wasn't prepared to learn that scalp cooling was not covered by my insurance because it was considered cosmetic, and that to receive the treatment, I would have to pay for it myself. Again, a devastating blow. Fortunately, I was able to pay $2,400 for the cost of my scalp cooling treatments. Now was the time to pass this meaningful legislation. We took the feedback offered from failed House Bill 1187 in 2025 and made the necessary changes requested. House Bill 1187 was introduced this past session and did not pass. It would have required health insurance, nonprofit health service plans, and health maintenance organizations that provide coverage for chemo to treat cancer and to provide coverage for scalp cooling systems used for the preservation of hair in connection with chemo treatment. In January 2026, the Maryland Healthcare Commission submitted a mandate study of House Bill 1187 showing that there was no significant financial impact to insurance companies, and that this study also showed that it improved the mental and social well-being of chemo patients. The American Medical Association has established CPT Category 1 codes, which set up a billing pathway. So what that means is that medical institutions can bill insurers and have it be covered. In closing, scalp cooling is a game changer for those undergoing chemo. I am a beneficiary of that. My hope is that we can make scalp cooling accessible and affordable to all Marylanders. I respectfully ask the Senate Finance Committee to pass this impactful legislation. My thoughts are with all Marylanders dealing with a cancer diagnosis. Thank you, Senators, for your time.
Thank you. Good afternoon. My name is Melissa Borstam. I work for Paxman, a medical device manufacturer of the Paxman scalp cooling system that is used during chemotherapy. And I've been working with scalp cooling devices for the past 10 years since the first device gained FDA clearance back in 2015. About 12% of patients will forego life-saving chemotherapy due to fear of hair loss. That is a statistic that is distressing to every oncologist. And I'm honored to be here today with these strong and passionate advocates who are sharing their personal emotional impact of hair loss during cancer treatment. So instead, I'm going to focus briefly on the clinical acceptance, availability, cost, fiscal impact, and health equity of this device. Scalp cooling is clinically accepted, as has been mentioned, and well established with a high degree of efficacy. In 2022, the American Medical Association adopted a resolution endorsing insurance coverage for scalp cooling. And this year, the service has been assigned Category 1 CPT codes, as Rosalind just mentioned. And additionally, the American Society of Clinical Oncology and Medesco have likewise been strong supporters of its role in cancer care. Scalp cooling is widely available today. More than 900 cancer centers nationwide offer FDA-cleared scalp cooling systems, and I'm pleased to say that in Maryland, 23 cancer centers provide scalp cooling, including both of the in-state NCI-designated comprehensive cancer centers, Johns Hopkins and University of Maryland. However, Maryland cancer centers currently treat scalp cooling as cash pay only. They are not billing insurers, not because the technology lacks acceptance, but because insurance coverage is inconsistent and unpredictable. This is a significant problem for providers. As a result, access to scalp cooling in Maryland is determined almost entirely by a patient's ability to pay out of pocket. The average cost to a patient for scalp cooling is approximately $2,500, while chemotherapy itself is typically tens of thousands of dollars. So the structure is disproportionately impacting lower-income patients, exacerbating existing inequities in cancer care. As the policy note concludes, it's minimal cost increase, so for insurers, the impact is limited, but for patients, this removes a significant financial barrier and creates more equitable access to that evidence-based care. Senate Bill 0272 provides predictable coverage, advances health equity, and ensures patients are not forced to choose between basic necessities and preserving quality of life during treatment. I will also add here just to clarify that, yes, there are 2 states that had insurance mandates that took effect in January of this year, New York and Louisiana. Additionally, very happy to report that there are now 10 states with pending legislation. California introduced legislation just yesterday, and then additionally we have Kentucky, Massachusetts, New Jersey, Ohio, Pennsylvania, Rhode Island, Virginia, and West Virginia. Thank you for your opportunity to testify, and I'd be happy to answer any questions.
Thank you all for your testimony. And I could really feel the pain that some of you have gone through, and I'm sorry that you've suffered through that. I do want to mention something I've learned since I've been on the Finance Committee. When we mandate Maryland insurance plans to pay for a coverage like this, number one, the MHCC has to rule on the cost, which they did and was very successful, but it only covers about 28% of people insured in Maryland because it doesn't cover federal plans, it doesn't cover self-insured plans, so there's still going to be a need to continue to go to the insurance companies and get prior approval. It will be effective for all Maryland plans, but not out of state. Like I said, not out of state, not federal, not self-insured. So we're not done yet, but it's certainly a big start. So thank you all for your testimony. Senator Mouth, you have a question?
Thank you, Madam Chair. For the manufacturer of the, let's say it incorrectly, this scalp cooling treatment, I was just online checking it out, and I was trying to understand. So this is simply, is there a specific temperature that needs to be maintained?
There is, yes. So the
What is that
device.
temperature?
So we measure the temperature of the coolant that is in the device, not actually. So it's just above freezing is the goal, to get your scalp to just above freezing. So the actual temperature is about 25-ish degrees, something like that.
I was just trying to figure out the expense. My son is an athlete, and I feel like I'm a physical trainer, so I bought and purchased a number of different, treatment type things, and just seemed to be expensive. And I was just wondering what makes that treatment, because it seems pretty straightforward what it's doing, but I guess it's the temperature is why.
Yes. So, the science of this is very, very basic. It's just vasoconstriction. You're cooling the scalp and limiting the chemo from getting to the hair follicles. But the art of administering the treatment is really where the technology comes into place. It's critically important to have a very tight fitting cap, and everybody's head has different shape and size, so that is no small thing to have that cap fitting tightly. And then it's also critically important to maintain that constant therapeutic temperature, which is another reason that you have these highly mechanized, automated systems to keep you right at that therapeutic range.
Thank you for providing some of that information.
I will also add one other thing to reassure you that we certainly have some parallel outreach with other payers to support all of these mandates that are happening right now.
I don't see any other questions. I have to figure out who's left to testify, though, because some of the folks on this were listed further down on the panel. So I'm going to I didn't have Amy and Laura on your panel. They were signed up, Senator, but they weren't on your panel.
Okay.
I don't think, did Catherine Alder testify? Okay, and then Sarah Campbell. Okay, well, we're going to bring you up next. Thank you. And also Allison Regic and Diane Fantone. Okay.
Should I go? Good afternoon. My name is Katie Alder. Next week marks the 1-year anniversary of the day that I was diagnosed with breast cancer at 29 years old. Over the past year, I've gone through 14 rounds of chemo, my most recent round being just 2 days ago, 2 surgeries, and the loss of control over so many aspects of my body, my life, and my future. Through all the uncertainty, having access to scalp cooling gave me the opportunity to hold on to control over the way that I presented myself to the world. It meant that I could tell people what I was going through on my own terms rather than being instantly identified as someone with cancer. Even though I suddenly felt different from everyone else my age, I didn't have to look different too. Now, as I'm getting closer to finishing up treatment and finally starting to imagine life on the other side of all of this, growing out my hair is one less thing that I have to worry about. This fall, I will be marrying my fiance, Josh, who spent hours learning how to put my cold cap on and tighten it perfectly. At our wedding, I will have scars from my port and scars from my surgeries, and I will be a different person than I was before my diagnosis in so many ways, but I won't have to wear a wig, and I'm so thankful for that. I know how lucky I am to have had access to scalp cooling, and I want every other cancer patient to have the same opportunity. Thank you for your consideration.
Thank you, Katie. Sarah Campbell.
Good afternoon. My name is Sarah Campbell, and I'm testifying in favor of State Bill 272. I'm a lifelong Maryland resident, currently living in Calvert County, and a 6-year breast cancer survivor who utilized the Paxman scalp cooling system. I was diagnosed with stage 3 HER2-positive breast cancer in January 2020 and started chemo 2.5 weeks after diagnosis. This included 6 rounds of docetaxel and carboplatin, where hair loss was a guaranteed side effect. I was upset it was beyond my control to hide that I was in treatment from anyone. I was concerned losing my hair would stress my kids, ages 2 and 4 at the time, and I wanted to minimize the impacts to them as much as possible. I did not want everyone, from clients I interacted with to parents at drop-off, to know I was in treatment. I did not want the pitying looks at the store when strangers see a bald mom with her young kids. I was not ashamed of the diagnosis, but I was not comfortable with people asking me about it. I was unaware of scalp cooling until the hospital introduced me to the Paxman scalp cooling system, which cost $1,600 in 2020 for my treatment. But I had other financial concerns to take into account when making my decision. I could not predict the total cost for my 1-year treatment plan when I was starting chemo first and had a year of treatment to get through. And my income was going to be reduced because I went on short-term disability at times and then other times just reduced my full-time work hours. Fortunately, I had 2 aunts who paid for most of my scalp cooling treatment. When I got a pixie cut 7 months after my last chemo, I learned the parents at drop-off thought I made a radical haircut decision, having no idea I received chemo. I am so fortunate I was able to scalp cool because it allowed me to share my cancer diagnosis and treatment on my own terms and mask the severity of the illness from my children. Access to scalp cooling systems should be available to everyone who wants to use them, regardless of cost. Thank you.
Who would like to go next?
I'll go. Hi, thank you very much for having me today. My name is Diane Fantone, and I live in Annapolis, Maryland, and I was diagnosed in December of 2022 with overwhelming diagnosis of breast cancer. I had breast cancer in my right breast, and I was triple negative, which I had no idea what triple negative was, but it's a very aggressive form of breast cancer. After all the planning and coming up with what my treatment would be, I learned that I had to have 6 months of chemotherapy, I had to have a double mastectomy, and I had to do 39 rounds of proton radiation treatment at the University of Maryland. I started the chemo in December, and prior to starting to that, I learned about cold capping. My family and I talked it over. The cost was quite high and not covered by insurance, considering all the other costs that were going into this treatment, and all I wanted to do was live and be alive and be, somewhat normal for my teenage daughter. Sorry. Anyway, so we looked into it, and we figured we would go ahead and do the cold capping. I read a lot on the Paxman website about great success stories. They were super positive throughout the whole process, and a lot of great tips, including wearing like a feminine pad on your forehead because it helps it from giving you freeze burn. You look kind of silly when you're doing it, but it was well worth it. I pretty much kept my hair the whole time that I had treatment. In the end, the red devil did kind of get to me, but I really felt like I was normal. I felt like nobody knew I was sick for the longest time. And one benefit also that I like to say about the cold capping is you lose your hair, but you go back very quickly. I think it was a matter of a couple weeks or a week
that I grew back, and it grows back thicker and healthier. Anyway, what I wanted to say is it's FDA approved. Louisiana and New York are doing it. I would love to see Maryland be right up there with everybody else. Cancer's not easy, but I think it does give us a little bit of dignity when we can have our hair and stand tall and not look as if that we're fighting an illness. Thank you.
Allison, before you begin, I'm going to ask Dr. Cross to come up. I understand she's here instead of virtually, so I don't want you to have to sit up here all by yourself, Dr. Cross. Allison, you want to start your testimony?
Good afternoon. My name is Allison Rejic, and I live in Anne Arundel County. I'm here in support of Senate Bill 0272, which would require insurance coverage for scalp cooling during chemotherapy. 8 years ago, I underwent chemotherapy, radiation, and surgery for stage 2 HER2-positive breast cancer. During treatment, I used DignaCap to preserve my hair, and it was truly life-changing. Keeping my hair gave me the confidence to continue going into the office and working throughout treatment. This helped me maintain a sense of normalcy during an incredibly frightening time. My survival mode at the time was to keep life as normal and uninterrupted as possible. As a mother of 2 young children, it was especially important that they didn't see their mom look sick. Maintaining our routines and shielding them from fear helped me stay grounded. Scalp cooling played a critical role in that stability. It transformed a difficult journey into something that felt more manageable. Unfortunately, scalp cooling wasn't covered by insurance and came with a significant out-of-pocket cost. I was fortunate enough to have family support, but many patients don't have that. I feel that no one should sacrifice well-being because of cost. I respectfully urge a favorable recommendation on this bill so that more cancer patients in Maryland can access and benefit from this meaningful therapy during treatment. Thank you.
And Dr. Cross?
Thank you so much. And to this chairman and the esteemed colleagues here and panelists, and I thank you so much for your testimonies. I'm Dr. Cross. I am a community leader, a local government leader, councilwoman at large in one of Prince George's largest municipalities. I think that one of the key things that we want to highlight here is we're not mandating that anyone pays for anything. There is still a clinical decision and a discussion that will happen. Co-capping has a roughly 60 to 90% success rate. And to that, it is determined also that we know that many people undergoing chemotherapy lose their hair, but that's just a minor side effect. Really, the hard part is our mental health and our mental awareness. When we go into a job, and really, it really is a critical thing to acknowledge that many people have lost their jobs. I can tell you that right up front, at least 20 or so of my greater friends have lost a lot of their colleagues because of the fact that they don't have their hair. And when they're walking with little sprigs flowing in the wind, it makes it hard for them to come in every day. It really is an important aspect that we look at the clinical proven evidence that has shown that there is intervention that matches modern science. We are no longer in a time where we cannot evolve. We do have the ability to support nearly 40% of the people who are now sitting not on this panel but out there in the world waiting for this success story. As we look at these effects, it is not only emotional. We don't see this as a cosmetic thing. This is something that you cannot hide from. Anybody ever had a bad haircut? I had one for 2.5 years. My hair didn't grow. So I ended up with caps and, weaves and wigs, which really irritated the scalp. I am asking for a favorable on Senate Bill 272. We can do this.
Thank you. Do I have any questions for this panel? I tell you, it makes me count my blessings. Thank you all for your testimony and for sharing your stories. We have one more virtual witness, Nancy Marshall. Nancy, if you will unmute, we'll hear your testimony.
There we go. My machine didn't want to turn me on. Good afternoon, Chair Beadle, Vice Chair Hayes, members of the committee. Thank you for your time this afternoon. I'm Nancy Marshall. I'm a breast cancer survivor of 20 years and co-founder of the Rapunzel Project, a nonprofit with the mission of creating awareness of the existence and efficacy of scalp cooling. In 2006, sometime after I was diagnosed, I learned I would not need chemotherapy because I had to have the big surgery, but it was considered a surgical cure. 3 years later, my best friend Shirley was diagnosed with an aggressive type of tumor that was determined to require chemotherapy. Almost accidentally, she learned about cold caps in Minnesota from an acquaintance who was one of the first women in the United States to use the caps. Her physician was skeptical, but said she could try them. 6 TCH treatments later, she shouldn't have had a hair on her head, and she had 90+% of her hair. Everyone was stunned. We launched the Rapunzel Project because we wanted patients to know that there was a viable option to save their hair. You can't choose it if you don't know about it. So battle one was awareness. We guided thousands of patients and were elated in 2015 and 17 when 2 systems received FDA clearance. We thought there would be quick adoption of such a game-changing technology. Physician and nurse acceptance has grown dramatically in the last decade, but as many as 58% of doctors, according to one study, don't recommend scalp cooling to their patients for fear they can't afford it. It's been a long battle. For most patients, the cost of scalp cooling is an inconceivable burden on top of medical expenses and lost wages. I'm here today because we believe access to scalp cooling should be equitable. All medically eligible patients should have the opportunity to choose scalp cooling to ameliorate chemotherapy's most dreaded side effect. Adoption of this bill would make Maryland only the 3rd state in the U.S. with such a law. Your leadership would mean a great deal as all these other states start to consider similar legislation. Thank you so much for your time.
Thank you very much. Do I have any questions for any of these witnesses? Seeing no questions, that ends the hearing on Senate Bill 120. Thank you very much for your testimony. Senator Ellis, thank you for your patience. Senate Bill 156, Railroads Required Crew for Movement of Freight. And I think you're going to bring up Christopher Alexander, Tom Cahill, Brittany Garris, and David Pendleton. I'm going to go get the tissues and
Good afternoon again, Chair Vital, Vice Chair Hayes, and members of the Finance Committee. Arthur Ellis here, District 28, Charles County, to present Senate Bill 156, Railroads Required Crew for Movement of Freight. So basically, right now, going through our state are these long freight trains with one crew member, and they're usually in front. Something happens in the back, these long, very long trains, no one notices. And we've had some accidents in the past where you look at home video camera footage and you see sparks in the back of the train way back, and those sparks kind of catch on fire, and that happened in, I think, East Palestine, Ohio, where a major chemical spill happened. And so we believe that a 2-person crew on these trains will be definitely safer for not just the crew, but for communities that these trains pass through. So this bill has been around quite a few years, but this year, there is movement on the bill. We have negotiated with the key stakeholders to come to agreement to say that this bill is contingent on a few surrounding states passing similar legislation. And the legislation this year on page 3, section 2, it says, that's line 14, section 1 of this act shall take effect contingent on the enactment of substantially similar legislation in the state of New York, the Commonwealth of Pennsylvania, and Virginia. Currently, the states of Washington, California, Nevada, Arizona, Colorado, Kansas, Minnesota, Wisconsin, Ohio, West Virginia, and New York, New Jersey have passed this legislation. This committee has supported rail safety many times in the past. Therefore, I ask for your favorable consideration again on Senate Bill 156. Thank you, Madam Chair.
Thank you, Senator. Who'd like to go next?
Good afternoon, Chair Vital and members of the committee. My name is Brittany Garris. I'm a Maryland resident and train conductor for about 7 years now with railroad experience. The first listed goals in the state rail plan is to enhance the safety and security of Maryland's multimodal transportation system to provide transportation in a resilient way to avoid natural and man-made disasters. With that goal in mind, I'm urging a favorable report for SB 156. I'd like to take this time to highlight a railroad accident that occurred in Weyowego, Wisconsin. A freight train containing hazardous materials derailed outside of this Wisconsin town. 30 cars derailed containing liquid petroleum and sodium hydroxide, causing a fire. The train conductor on the derailed train served as the first responder and the incident commander before the fire department and medical services arrived on scene. He prevented a great tragedy by acting quickly and separating the non-derailed cars from the fire-engulfed derailed cars. On arrival, the fire department chief concern was that the train cars would explode. They quickly determined that the town's 2,200 residents have to be evacuated. The residents were notified they had to immediately evacuate, leaving their homes and belongings behind. This wasn't an orderly evacuation. Imagine being in your home with your family, having a firefighter out front your home yelling to evacuate now. The residents didn't know where to go when they returned, nor could they ask any questions about what was going on. If this happened in Baltimore, Hyattsville, Cumberland, or any other densely populated community that freight trains operate through in Maryland, it would be catastrophic. Following this terrible accident, Wisconsin passed their two-person crew requirement into law. I thank you for your time and urge a favorable report.
Thank you. Who's
You're
next?
welcome.
Chairman Bedang and members of the committee. My name is Christopher Alexander. I'm a train conductor and resident of Maryland Legislative District 32. The rail industry lives by the word safety first. With that in mind, I'm here to ask for a favorable report on SB 156. Historically, safe working rules and procedures for all railroaders have been written in blood, and in 2013, the town of Megantic, Canada, a train loaded with hazardous materials, staffed with only one crew member, ran away and derailed. The train ran away due to the single-person crew member being unable to properly secure that train. The derailment essentially destroyed downtown Megantic, killing 47 people, destroying 115 businesses, and contaminating 50 miles of waterways. Following the tragedy, the Canadian government banned single freight train operations. The railroad argues that states shouldn't be act on crew sizes because there is a federal rule in place. To that I say a rule does not have the strength of law and can easily be rescinded with the stroke of a pen. The second argument they make is that their technology, positive train control, renders it unnecessary to have multiple crew members because the technology will automatically apply the brakes of a train and appropriate action isn't taken by the engineer. Technology is great when it works. Unfortunately for this technology, far too often it does not. MARC commuter train frequently has to cancel its trains because of connectivity issues with PTC. Secondly, the PTC cannot perform brake tests, walk a train, clear obstructions from a track, nor can it detect if one is there. The truth is, second judgment is required and needs to operate trains safely, something PTC cannot provide. I thank you for your consideration and ask for a favorable report.
Thank you. David, no, Tony, Tom's next.
Yes. Hello, Chair Vidal, Vice Chair Hayes, and members of the committee. My name is Tom Cahill. I'm a District 5 resident and a locomotive engineer with over 30 years of service. I'm here urging a favorable report on SB 156, Railroads Require Crew for Movement of Freight. Freight train crews work long hours, day and night, with few set shifts and are on call 24 hours a day, 7 days a week. With little notice, we are required to report to work for a 12-hour shift, often operating trains laden with hazardous materials. Fatigue in the railroad industry is our organization's #1 safety concern, and having a minimum of 2 crew members is the primary way we combat fatigue. Having a minimum 2-person crew is also the best way to ensure compliance with the railroad's complex operating rules. Adequate personnel are critical to ensuring railroad operational safety, security, and in the event of a hazardous materials incident, support of first responder activities. This legislation regulating minimum railroad crew staffing is a proactive effort to protect and promote worker health and safety, as well as the security and welfare of the residents of the state by reducing the risk exposure to local communities and protecting environmentally sensitive lands and waterways. A freight train derailment that occurred in East Palestine, Ohio, where a freight train carrying hazardous materials derailed and caught fire, caused the evacuation of the entire community. This tragedy in East Palestine has inflicted horrors on the residents of this town. It has caused billions in claims and remediation costs. Years later, traces of vinyl chloride and other hazardous materials in the train's consist are still found in the town's soil, waterways, and furnace filters. This derailment stands as a powerful reminder of the potential for disaster with freight rail. As awful as this tragedy was, it would have been worse if the 2-person train crew didn't take immediate action in separating the derailed cars from the non-derailed cars, preventing a greater tragedy. With these things in mind, I ask for your favorable support. This is just common sense legislation that we need to get on the books for our state, and as the surrounding states fill out with their 2-person requirements. Thank you.
And finally, David.
Chair Bottle and members of the Senate Finance Committee, hello, my name is David Pendleton. I'm the Director for the Maryland Safety and Legislative Board of the Transportation Division for the International Association of Sheet Metal, Air, Rail, and Transportation Workers, SMART. Our members in Maryland are employees of CSX, Norfolk Southern, Amtrak, Canton Railroad, and Mark and Alstom. We are conductors, engineers, yard masters, switchmen, and utility persons. Our mission is first and foremost to seek to ensure our members have a safe work environment. And in that vein, I am today urging the committee to vote favorable for SB 156. Freight trains operate literally across the street from vital government buildings and right through the hearts of cities and towns such as Cumberland, Gaithersburg, Rockville, Perryville, and Baltimore City. Freight railroad operations are complex and often entail the transport of highly hazardous materials such as crude oil, chlorine gas, and many other chemicals. There has been an increase in the shipment of these hazardous materials, as well as significantly longer trains operating over the uniquely and widely varying geographical terrain of our state. This, coupled with the possibility of decreasing train crew size, creates a significant localized safety hazard to the public and the communities our trains operate through. The 3 accidents that are highlighted by my colleagues on this panel showed how quick action taken by a 2-person train crew helped save lives and property, while the operation of a single-person train crew led to the destruction of lives and property. Support for 2-person crew legislation has been broad in Maryland. The cities of Baltimore and Cumberland, along with the counties of Anne Arundel, Baltimore, Montgomery, and Prince George's, have either passed resolutions or provided letters of support for passage of expansive rail safety legislation that also included 2-person crew. I have included them in my written testimony for your review. This legislation has passed multiple times by the General Assembly and voted favorably by this committee. It is time for Maryland to get on board this train and join the many states that have passed this legislation. I urge a favorable report on SB 156.
Thank you. Senator Hershey?
Thank you, Madam Chair. Just a quick question for the sponsor. This year's difference is that it has a contingency with 3 other states. You said New York, Pennsylvania, and Virginia.
Delaware, Senator.
New York, Pennsylvania.
New York, Pennsylvania, and Delaware.
New York, Pennsylvania, and Delaware? Okay. And did you also mention that New York had already passed?
Yes, New York is in the pass column, according to my notes.
Jersey has passed. New Jersey's the recent pass. New York has passed.
Well, Mr. Pendleton will answer.
Okay.
He's whispering to me right here.
Mr. Pendleton knew I was getting to him next. So that's fine.
Senator, always a pleasure, sir.
You as well.
So it is contingent on Pennsylvania, Virginia, and the state of New York passing
Okay.
similar legislation.
That's right. Okay. But you said New York has already passed.
New York has already passed legislation,
So,
yes,
so it's
sir.
really just contingent on the next 2, in a sense?
That would be correct, sir.
Okay. The Federal Railroad Administration did issue a final rule. And what is that final rule?
Sir, it's very long and complex, but in a nutshell, it does have 2-person crew, but it has provisions in it that will allow it to go to completely unmanned operation of a train.
Okay. But it does right now, it is a 2-person crew, right?
Yes, sir, it is.
And it does preempt state law.
Yes, sir. So for this law to go into effect, as stated in the fiscal note, that federal rule will have to be revoked. Yes,
Right.
sir.
And have we seen efforts to do that? Is that what's going on, or?
Sir, to my knowledge, the Class 1 railroads have sued to overturn the rule. I do not know the status of that, of the case at this time.
All right. I'm sure you're familiar with this testimony that MTA provided, that they have an access agreement, MTA and CSX. And it says that it includes a provision requiring MTA to reimburse CSX up to $6 million annually if the state enacts laws or regulations that increase minimum train crew size requirements. Familiar with that?
Yes, sir, I am familiar with it.
So would you be then willing to say that if this federal law was undone, Pennsylvania and Virginia decide to agree, we could be looking at $6 million a year annual payment to CSX?
No, sir, I don't think so.
Okay.
The reason, the next paragraph in the fiscal note reads, the applicable collective bargaining agreement requires operation of trains with 2-person crews until CSX demonstrates that it has modified such agreements in accordance with federal law to permit operation of trains with fewer than a 2-person crew. So they would have to provide a collective bargaining agreement saying that we're down to a single person or no person. The federal rule would have to be revoked as well. That reads in paragraph 2. And we just did a collective bargaining agreement in 2025. It's for 5 years, correct? So that takes it to 2030, at which case the operating agreement or the access agreement will likely have expired, and I'd imagine the Moore administration will not be inclined to give CSX that same language.
Okay, so that would expire within the next 5 years, is that what you said, or 5 years?
It's a 5-year agreement, yes, sir.
Okay.
And just to add to that, typically collective bargaining agreements take a longer time to negotiate, so I'm pretty sure this access agreement will be expired before CSX could produce a new one.
Okay. There was also comments about the partnership between the state and CSX on the Howard Street Tunnel. And I thought that CSX had made some mention that they were ensured that, where is it here? Made possible through a close partnership between the state, federal government, and the private sector. And then they said further that they were, the project was advanced under a stable and predictable regulatory framework with the shared understanding that railroad operations would continue to be governed primarily at the federal level. This makes it sound like CSX was told something would occur in order to get their participation in that tunnel, and then it's being pulled back from underneath them. You don't see it that way?
Well, sir, I would, unfortunately, those conversations was made way above my pay grade, sir. What I would say is I don't see any difference in the regulatory framework. The federal rule is still in place. And so the tunnel will continue to operate as mandated by federal regulation. If the federal rule is withdrawn, then it is incumbent on the state of Maryland to decide, hey, we want safe railways through our state. And so that's what this is about. I can't speak any further as far as what promises were made, though. That was
Okay, I understand. All right, thank you very much, sir. Always good to see you.
looking forward to our meeting next week, sir.
Absolutely.
All right.
Thank you, Madam Chair.
Thank you. David, you mentioned you have a collective bargaining agreement in place till 2030.
Yes, ma'am.
And does that agreement require a two-man crew?
Yes, ma'am, it does.
How long have you had that in your collective bargaining agreement?
I would say very long time, ma'am. Yeah, it stems from the 85 agreement back.
I've been voting for this for a very long time, Mr. Pendleton.
And I hope this is the last time, Madam Chair.
But I just wonder if you've had it in the collective bargaining agreement for a very long time, like 40 years, at what point do you think you'd really have to fight to get it out? It's kind of difficult to remove something that's been there so long.
Oh, no, ma'am, that's not the case at all.
Okay.
So through the collective bargaining process, if the two parties can't agree, then a presidential emergency board gets appointed. That presidential emergency board, whoever the moderator is on that, they can say, we side with the railroad, and the second person is snatched. They could say, we side with the railroad, and both persons are snatched. Back in the 70s, there was 5-man crews, or 5-member crews, my apologies. Today, on freight trains, we're down to 2. And so it's really a question of, would we like to have a Lac-Megantic situation happen here in the state of Maryland? Because God forbid it happened in Baltimore City. You can't evacuate Baltimore City. Can't evacuate DC or Crofton or many other cities that our trains operate clean through.
Thank you.
You're very
Good.
welcome.
Any other questions for this panel? Thank you all for your testimony. We do have 2 unfavorable, Sean Malone and Brian Hammock.
Good afternoon, Madam Chair, members of the committee. My name is Sean Malone. On behalf of Norfolk Southern, we're testifying in opposition to Senate Bill 156. Primarily what I want to focus on today is really that, to the chair's point, this is already in the collective bargaining agreement. This language the parties have agreed to. We encourage collective bargaining through the General Assembly for when employees organize. We believe that's a right. And the process is in place that has already put this in effect. Norfolk Southern's primary concern with this bill is that we really want to be able to conduct, when we conduct negotiations, provisions of our contract shouldn't be cherry-picked and put in the law. They should remain part of that collective bargaining process. This has been in place for over 40 years. Norfolk Southern has no plans to put a provision on the table to remove it. It is not as simple to remove established language from a contract as simply a disagreement and a board siding one way or the other. There is a presumption in favor of negotiated and certainly long-standing language that remain in the contract. It's as an old negotiator told me, it's much like trying to extract a tooth. It's very painful. It's hard to do. To take an existing clause when the parties don't agree, there's a presumption that that clause can be operated with. I will compliment the sponsor. This is a much shorter bill than last year's. It appeals to my dyslexic nature. I only had to read a few paragraphs. But I do not see any language in the recitals that indicate that this bill only comes into effect if the FRA rule is removed. That may have been the intent. I know my opponent be a man of integrity, but I just don't see it in the bill, and maybe I've misread it. We as an industry are simply asking that we deal with one regulator, not 50 different states, and we be able to bargain in good faith at the table. With that, we oppose.
Good afternoon, Madam Chair, members of the Senate Finance Committee. My name is Brian Hammock. I'm speaking on behalf of CSX Transportation. The oldest railroad in America, founded as the B&O almost 200 years ago, thanks to the General Assembly and the City of Baltimore. I want to make 3 points today. Firstly, that a state law of this nature is not necessary. Secondly, it's preempted by existing federal law. And the third is that if this were to take effect, there is a fiscal impact to the Transportation Trust Fund. Regarding necessity, as Mr. Malone said, there's collective bargaining agreements in place. Those apply to CSX transportation as well, and they're going to be in place for the foreseeable future. In addition, the Federal Railroad Administration has passed a comprehensive 58-page rule that requires two-person crews under what this bill would require, but many other circumstances as well. Regarding federal preemption, that federal rule has an express provision that says that states may not regulate crew size. In addition, going back to 1973 when Congress passed the Regional Rail Realignment Act, the 3Rs Act, that contained an express provision that states could not regulate the size of a train crew. And then finally, I want to address the MARC access agreement. So this bill says if freight's operating on the same corridor as passenger, you have to have two people in the freight train, not the passenger train, but in the freight train. We have passenger rail on our network in the form of MARC Camden and Brunswick lines. So under our agreement with the state, we said if the state imposes a regulation of this nature, then we could recoup the cost of that up to $6 million. That was an underpinning of our negotiations with MARC for access. And MARC comes asking for additional access each round. So we don't envision that provision would be going away in the near future. Thank you. And we ask for an unfavorable report.
Thank you. I see a question from Senator Reedy.
Thank you, Madam Chair. I'm just curious, we've talked a little bit about federal preemption, and we've been talking a lot about federal preemption in the Senate these last few days. I was curious about at the federal level, are they basing those decisions on safety? Is that part of the calculation? Obviously has to be about safety, correct? So I think for this bill, I don't like to hear about unmanned trains, which I know is a federal thing, and some of that nature. We've seen train derailment. So could you guys, either one of you, talk about why we shouldn't put this in law just to ensure, safety, that there'll always be two people on a crew?
It's a good question. So, yeah, I think it's both safety and making this national network of rail economically viable. So if you go back to the 70s and 80s, there was a time in Maryland when you had dozens of different railroads that operated in the state. Many of them went bankrupt because there was a patchwork of state regulations on all manner of issues because there was no federal framework for railroads. So in the Regional Rail Realignment Act in 1973, and the creation of the ICC and eventually becoming the Surface Transportation Board, there's a robust body of federal law that regulates the national network of railroads because they're so integral to our supply chain.
Right.
So, particularly in the Northeast, where you might start a train assignment in the morning in one state and finish 3 or 4 states away, not necessarily the same out west, where they are regulated federally under some different rules as it relates to crew size. So you've seen in states, there was a number mentioned that had passed this. West Virginia passed it years ago and it was struck down in federal court. Illinois passed it 5 years ago, it was struck down in federal court. New York passed it last year, it's being challenged, and New Jersey passed it last month. Everywhere in the Northeast and Midwest is covered by the 3Rs Act.
And the striking down of it is because it violates federal law? Is it fair to say federal law or is it federal regulations?
On 3R is saying that the STB, or its predecessor, the ICC, is the regulatory body of the National Railway System.
So much like we couldn't pass a bill regulating airline flights that come into BWI, like as far as how they operate in the air,
Exactly.
That's the argument here, is that we cannot, and that's the argument they'll make, federal will make.
And then to the
So it's fair to say,
safety
and because I don't want to belabor, it's fair to say your clients are not objecting to it on the grounds of we don't want to employ 2 people. You're objecting to it on the grounds, we don't want to have to staff 2. You're objecting to it on the grounds that there's a federal standard, and therefore we shouldn't start, if we start passing a patchwork, it's not untenable.
That's Norfolk Southern's position, is that there's 2 ways to deal with this. One, we've dealt with it at the collective bargaining table. We've agreed to put this in our contract. It's been there for, 4 decades plus. And then secondly, it's just not economical for us to have to wage these battles in 50 states or for the contiguous states when the discussion's really already regulated federally. That's the place for us to go. That's the appropriate forum for these disputes.
Because the headline on any bill like this is going to be, why don't you want to vote to mandate 2 people driving a train? And I probably would vote if we had to, if it was up to me to just vote it, because I think you should have 2 people manning most of these trains. But you've explained the issue. Help me understand. Thank you very much.
Senator Ellis.
Thank you, Madam Chair. Quick question, Ms. Amick. Good to see you again. Good to see you. A couple things. Did you say that currently there are 2-person crews on all these freight trains going through Maryland?
That's correct. In freight trains everywhere in America, there are 2-person crews on Class 1 railroads like CSX and Norfolk Southern. On the MARC trains, the Amtrak, there's a single person in the cab of the train. There's other crew members dispersed throughout the train, but in the cab of the train, there's only 1. But on freight, there's 2 in the cab.
Yeah, and so this bill is basically for freight trains, right?
Right.
So you doing what the bill recommend now. So what would be the opposition to a bill that does what you are doing already? I'm not sure.
There's if I may, Senator, it's more the concept, I think, that Senator Reedy was speaking about, is that we're objecting to a patchwork of laws where states start to come in and get involved in the regulation of railroads when we already have a federal regulator that we deal with. And in essence, we have belts, we have suspenders, we're just putting another belt on this, and we just don't think it's necessary.
Yeah, got it. And you talked about the $6 million clause in the MARC contract. Basically, your company owned the tracks that MARC used. So you kind of basically held them at hostage. If you want to move these commuters, you got to agree to this, because I see no relationship with, moving commuters, getting them off our busy roads with, how many people driving a train or on a train, a freight train, 2-person, and you're doing it anyway. So I'm trying to figure out what is the fear of this bill when you're doing it already, and why you have to impose that $6 million clause in Maryland moving its commuters, because we have some of the worst traffic in the nation of Maryland, because Maryland's grown so much and, it's such a vibrant state. So basically, we need you. And so you just kind of force that $6 million clause in there to really hold the state hostage to not pass this bill to do something that you're doing already. It's really kind of confusing to me, but anyway.
Well, the relationship there between the MARC contract and the freight, it goes to line 14 on page 2 of your bill. This subsection applies to railroad trains used in connection with the movement of railroad freight that shares the same rail corridor as a high-speed passenger or commuter train. So our corridor in the MARC Camden and Brunswick lines are shared with the MARC trains. So when we allow that access through our access agreement with MARC, but for that provision in this law, if federal law didn't apply, which it does, if collective bargaining didn't apply, which it does, and only this law was in effect, then we would be able to recoup the cost. So it's sort of, does this bill solve a problem? There's belt and suspenders that have solved that problem. But if this bill were to take effect, then we do have that protection in place, because we do want to allow that continued service on our line, but we don't want to be penalized for it, particularly, when we have a competitor in the state that doesn't have that same structure with passenger rail.
Yeah, okay, yeah. We can talk about this afterwards. I don't have
Yes, sir.
strictly time to relieve my kind of like the disconnect I'm having with, what you're saying and what you're opposing. So we can talk offline. Thank you, Madam Chair.
Thank you, Senator. That ends the hearing for,
Thank you.
Thank you.
for this bill, and we're going to now go. Senator McCray, are you presenting, or is Sayer Hill presenting? Sayer Hill will be presenting. Pardon me? You're going to present? So this is Senate Bill 286. Senator McCray is the sponsor. Welcome. John Kern, Sarah Matthew, and Crystal Parker.
And I'll do 30 seconds, Madam Chair. For the record, Corey McCray, Senator for the 45th Legislative District. But one of the things that Madam Chair, me being able to work under her tutelage, is that people, when they get opportunities, that's how we learn and that's how we grow. So Zaya Hill will be presenting. She's at the University of Maryland College Park. She's finished her bachelor's there, currently working on her master's there, and we look forward to her doing well today.
Hello. Good afternoon, Madam Chair, Vice Chair, and members of the committee. My name is Zaire Hill, for the record, a staff member of Senator McCray, and I'm here on behalf of him to support Senate Bill 286. Senate Bill 286 will create a searchable public database of elevator inspection certificates in the state of Maryland. This bill will allow residents, tenants, workers, and visitors to easily verify whether an elevator has been properly inspected and is approved for use. By making this information accessible and easy to understand, the bill strengthens public support and trust and safety of buildings for Marylanders everywhere for everyday use. This legislation was brought to my attention by constituent Ms. Sarah Matthews and reflects a real concern for the community about access to safety and information. Thank you all.
Thank you. Well done. Who would like to go next?
Good afternoon, Finance Committee. My name is Sarah Matthews, founder of the Empowerment Team. I am respectfully present here today, encouraging a favorable consensus on SB 286 in concert with approximately 143,000 older adults whose manual mission is senior residential housing complex in Baltimore City. This legislation is very much needed, especially to hold management and owners of senior residential housing accountable for their inoperable and malfunctioning elevators, which affects the safety and well-being of older adults, disabled, and veterans tenants, especially veterans who are double amputees. This database is needed to provide notification to elected officials, the Baltimore City Department of Equity and Civil Rights, and the general public prior to dollar recertification of compliance for elevators. Complications and a lack of determination is lacking in the current system to address recertification of inoperable elevators. It is my hope that DOLLA will partner with the Empowerment Team, who can provide critical feedback for this database, beginning with an additional category for inoperable elevator dates. Currently, the notification regarding inoperable elevators is non-existent. I implore you to vote in favor of SB 286 because it is the pathway to modernization of the elevator inspection and certification process while highlighting inoperable and malfunctioning elevator. Thank you so much for your time and consideration.
Thank you. John Kern?
Thank you, Madam Chair, and
Mr. Vice Chair, who is my senator, I'm devastated that he stepped out of the room. And the committee members, my name is John Kern. I'm with a housing nonprofit in Baltimore City. Most of our clients are homeowners in the city, but have, older adult relatives and folks that want to move into residential buildings. So having a database like this for them to quickly search and check on how the elevator's been in the buildings would be really, really helpful for them. And largely, we support any bill that aggregates data in an easier database for folks to search, whether you're an advocate or a resident. We think that that's great. In addition, we've seen state agencies use these databases as platforms to continue to build and add information over time. So one idea is once this is up and running, if the Department of Labor would be willing, you could take all of the elevator incident reports that are fileable by the residents, and then you could aggregate those. So you could begin to build a kind of record on how the elevators have been functioning. Right now, you've got to recertify them every year, but we've seen them sit for 6 months and then get recertified. If you look at the record, it was up and running. You can't really see what was happening in between the time it was recertified. So anyway, it's a really great first step, and really thank the senator for leading on this.
Thank you, John. And finally, Crystal Parker, you're favorable with amendment.
We kind of changed that. Good afternoon, committee and committee chair Beidel. My name's Crystal Parker, and I am a resident of Baltimore City, District 40. I am also a community leader, and I've been an advocate for older adults little more than over 20 years. And so I am in kind of a precarious situation because, one, I get those calls 4 a.m. in the morning, 7 a.m., 11 p.m., 4 p.m. With a lot of issues. But the overwhelming issue is going to those buildings and elevators being out. And we having older adults with limited mobility, we having people in wheelchairs, and just the whole cohort of persons that need this type of frequency of transport and mobility support. So, and one of the things is that getting stuck on the elevator causes trauma for anybody, even if you're not in one of those categories. So we have been able to be in a part of those situations as well. This bill creates an opportunity for us who are advocates to be able to use the data to then implore residential management and owners to be more involved and consistent about taking care of the buildings and the infrastructure. We have some buildings that are more than 50-some years old, and they are broken 2 or 3 times within a month. And during national health crisis, you have one elevator. It's not even 6 feet apart. So these are just some of the issues in this bill, and creating this data that is searchable, that helps us to then assist residents with finding the information, being supportive of them. We can do our work more efficiently as advocates, and with the help and support of Dollar and Senator McCray in pushing legislation like this, this helps us to be greater advocates for the overall community. So please support Senate Bill 286. Thank you.
Thank you for your testimony. Do I have any questions for this panel? Seeing none, it's because you did such a good job. That ends the hearing on Senate Bill 286. Thank you, Senator. Nice to see you here. Our final bill for the day is Senate Bill 304, Senator Bailey, a bill that we've heard before, collisions with wild animals, prohibited actions by insurer. And we have 2 proponents and 2 opponents. So, Senator Bailey, I only see you as the proponent.
Thank you, Madam Chair. Distinguished members of the committee, I'm proud to be here today. I'm going to talk to you for a few minutes about some deer strikes and animal strikes. But for the record, Senator Jack Bailey representing District 29, and I represent St. Mary's in Calvert County. Senate Bill 304 would prohibit an insurer with respect to private passenger motor vehicle insurance from increasing a premium, adding a surcharge, or removing, altering, or refusing to consider a discount based on accidents or losses caused by a collision with a free-roaming wild animal and for which the insurer was not at fault for the loss. And I'm sure that you all hear this many times from your constituents. As you can see, the bipartisan group that has signed on to this bill, everybody, just this week, I went to the southern states to get some bird feed. And while I was standing in line getting bird feed, a young lady came in and expressed how upset she was at the cost of her insurance. And the fact that it had almost doubled because they had struck a deer in the evening on a road, and it was their second accident, and their premium had increased. After the 2024 session, the Maryland Insurance Administration conducted a study to examine current insurer practices with regards to increasing premiums based on collisions with wild animals. The study found that no insurance companies in Maryland removed a discount specifically for this collision. However, it did find that 7 companies applied surcharges due to a claim for a collision with wildlife, and 15 companies considered the overall number of dollar amount of claims under comprehensive coverage, including collisions with wildlife, to determine qualifications for a safe driver or loss-free discount. Senate Bill 304 would prohibit these practices to ensure the consumers are protected from the risk of premium increases resulting from these deer strikes. And just to put it in perspective, obviously we have a tremendous deer herd in Maryland. And deer strikes are somewhere around 30 to 40,000 deer strikes in Maryland a year, right? So this bill is not just affect, I started this bill reference to a deer strike of me being stationary on the highway, and the deer ran into me, and they raised my my rate, by 26% because the deer ran into me, while I was sitting stationary. I'm like, I just don't think that is fair. But the fact is, that's happening to 30 or 40,000 of our constituents in Maryland a year. And I think that this is a bill that we all should take notice of. As we are all aware, these deer collisions are far too common in Maryland. I don't believe that Marylanders should be required to pay more for their auto insurance because of an accident that they had no fault in. This legislation is intended to ensure that Marylanders who find themselves in a similar situation in the future are protected from the increases that I experienced and many of my constituents and many of your constituents have experienced. I respectfully request a favorable report on Senate Bill 304. I thank you all for your consideration.
Jack? Senator Bailey, do you know, maybe that deer that ran into you remembered seeing you out hunting deer. What do you think? He's paying you back?
And I'll tell you, thank you very much, Madam Chair. I appreciate that because one of your colleagues has made that reference, that maybe that has happened. But I will tell you that today I just came from dropping a expansion of Sunday hunting that would help us regulate more of those deer and lessen those deer strikes. So if anybody's interested, I would love to have you help me with that bill.
Thank you, Senator Bailey. I don't see, I do see a question. Senator Mounts.
Thank you, Madam Chair. And so I'm sure opponents will say, well, there are some policies that cover wild animal damage from wild animals, and there's some that aren't, and that consumers should shop for which policy has those types of coverages and things like that. How would you respond to that?
So at the same time, that if there was a storm, if a tree fell on your car, if there was any incident that was God-related, from that, would they consider that at the same thing, a comprehensive claim? And the answer to that is across the board most of the time, no, right? When you don't even see the animal, the woman that came up to me on Monday who talked to me at the Southern States, she didn't even see the animal that struck them. right? And of course, then they face that claim. So I just think there's nothing that you can do to defend yourself in this situation.
I want to make sure you had opportunity to put that on the record. Thank you.
Thank you.
Thank you, Senator. I don't see any other questions. We do have two unfavorables. Gino Ratuno from NAMIC and Bryson Poppin also from MAMIC, and I, A, and B. Thank you both.
Thank you. Good luck.
Thank you.
Thank you, Madam Chairman, members of the committee. Bryson Popham on behalf of the Maryland Association of Mutual Insurance Companies in respectful opposition to Senate Bill 304 now for the third year. You know, sometimes you come into contact with a legislator, and even if you're on different sides of an issue, you become friends. I like to think that Senator Bailey and I are friends. I understand. I had a long talk with him 2 years ago. I fully understand his frustration, but respectfully, I'd suggest the approach that we follow now is the better one. And that is contained in the MIA study that each of you received a couple of years ago. Senator Bailey's right. 30,000 to 40,000 a year deer collisions. Now, those losses have to be paid by somebody. And if you pass this bill, they're going to be spread out across a whole lot of people who have never perhaps seen a deer, much less hit one. So we have to depend on our regulator to assure that the laws are administered fairly, and we believe they are in this case. And for that reason, we don't believe that removing this rating factor would do anything other than increase premiums for some other people. I, too, am sorry that the vice chair is no longer with us, because I think last time I asked him, he saw a deer collision in his district, and I suspect it's a rare occurrence. So we would respectfully request an unfavorable report. Now, having said that, I am intrigued. Senator Bailey and I talked out in the hallway about his bill, and that I don't know if it's going to come before this committee, probably not, but I'm going to recommend to our legislative committee that we give serious consideration to supporting that. That's a better way to address a real problem here. We have too many deer in this state, and we have too many deer collisions. But Senator Motz gave you the right answer. If you want to make sure you don't pay for these, shop for insurance. Thank you.
All right. Good afternoon, Madam Chair, committee members. Thank you so much for the opportunity to speak today. My name is Gina Ratuno, and on behalf of the National Association of Mutual Insurance Companies, we must respectfully oppose Senate Bill 304. While we understand the intent of Senate Bill 304, this bill poses significant issues for how the insurance market operates. While drivers may not be at fault in these collisions, there are still factors like location and driving habits that may increase risk. To accurately price premiums, insurers must determine to the best degree possible an individual's risk. And in order to offer competitive policies, insurers use a number of factors and models to predict and analyze any sort of potential losses or change in accurate prices to policyholders. Wildlife collisions are a real and oftentimes unpredictable risks that vary by location, season, and under the factors. As referenced, an MIA report from December 2024 found that collisions with wildlife, particularly deer, account for significant losses to drivers and their insurers in Maryland. As said before, there are over 30,000 claims for these collisions with wildlife each year. They also found that the majority of carriers in Maryland do not apply surcharges specifically for collisions with deer or other wildlife. Ultimately, through risk-based pricing, insurers can offer customers competitive rates while remaining financially solvent. Without the ability to adjust premiums based on claims, insurers may struggle to cover the rising costs of wildlife-related claims, potentially jeopardizing the stability of the market. This could lead to fewer choices for consumers and a less competitive market overall. Because this bill would artificially limit insurers' abilities to accurately price and assess risk, if enacted, SB 551 would likely not lower the cost of insurance and instead may create upward pressure on all auto insurance premiums. For these reasons, we respectfully oppose Senate Bill 304. Thank you.
Thank you, Gina. Senator Mounts.
Thank you, Madam Chair, and Bryson, and thank you for your testimony. So this bill, we've been talking about this for quite a while.
Yes.
Even prior to the incidents that involved Senator Bailey. And, this is a real problem. It's a huge hazard. It is a bigger discussion than just insurance and policies and things like that. We're talking state management of a resource that Senator Bailey probably talked about in the hallway. And it's interesting because that letter was very informative. And I can recollect about 6 years ago serving on Economic Matters and asking if any insurance company had any information on damage, because in our district, it's really sad to see, what's happening on the roads. At the time, there was no information. And the letter, I think it was from State Farm that did that calculated that. It was very helpful. Please thank them for that. And I was encouraged to hear you mention that the idea that maybe you don't agree with this bill, but you agree with the idea you heard in the hallway. But my question is as well, if you agree with that, what is the industry, when are they going to take it seriously and actually get involved? I mean, this is a big deal, and I've heard about it for a long time. I haven't introduced bills. I haven't gotten involved. I have in deer management, but in rural areas, I mean, it is kind of, I was in the town of Easton 3 weeks ago in downtown Easton. I almost hit a deer in downtown Easton. What is the industry seriously going to get involved, or is that just?
Senator, it's a real problem. I agree.
And the deer almost hit me in Easton. I couldn't believe it.
And that's what happened to Senator Bailey. He was stationary and the deer hit him. What I can tell you is this. Normally, we wouldn't consider a bill like Senator Bailey just described to me out in the hallway. But for the very reasons you just identified, we need to look at this as a larger problem. And maybe this particular solution is not the one that works. But I like the idea that he has behind his bill. We're going to look at it very closely. We'll discuss it Monday when we have our meeting. I am going to urge our legislative committee, here's news for you, Gina, that we support the bill, because you're right. We need to do something about this very significant problem. And Madam Chair, you and I as Anne Arundel County representatives, we see deer all over the place all the time. So it isn't just on the shore, although I know it's a particular problem there. It's everywhere.
Correct. And this log jam, and it is mismanagement, and it is wrong, and it is unbelievable that we can't fix this, and it's been stuck in Annapolis. I mean, this problem has been created in these buildings with some of the things that have been done, and something has to happen to change that. And if the industry were to get involved, that could make a difference. I've got friends that have been I got a friend just within the last 6 months was in shock trauma because he was driving home on his moped and a deer ran out and he broke his neck. And that's not, I mean, there's several people I know that their lives have been changed because of this. And it's not, I mean, it's fun to talk about, but if the industry is serious about it, I hope that they are. And it would be fantastic because I think they would be embraced their support and actually getting something meaningful done about this, because it's serious.
I'm hoping, Senator, that that's the case. I hope they look at Senator Bailey's bill and feel about it as I do, as you do. It is something that we need to address. The insurance industry, frankly, is more reactive than proactive, and this requires a proactive approach. I'm sure you'd agree.
I would agree 100%. And I don't think there's a lot of risk in getting involved when you're paying out 30,000 claims in a year. And these claims now, with the sensors on the vehicles, what used to be a $2,000 repair is $10,000 to $12,000.
Absolutely right.
I need to tell a little story. We have a couple of acres of property that we feed deer. We have about a dozen deer that have lived there. And my brother-in-law just went around the block to Andover Road. You know where we live, near the airport, very congested. And 2 deer ran into him, did $10,000 worth of damage to his car. And I know these were the deer we were feeding, so. The deer that bite you back in the hand. Senator Kramer?
Thank you, Madam Chair. Bryson, I too have sought to see if I could be friends with the good Senator Bailey. As you have, unfortunately, he's declined that up till now. But I love him just the same. And I have to say that, and I also get the committee chair's point about the good senator was probably sitting there in his truck with his blaze orange Elmer Fudd hat on, and that buck recognized him and decided it was payback time. But what I'm trying to grasp is the notion that the claim, well, let me ask you this. At what point, how many claims can a person have being struck by an animal before they're possibly looking at an increase in their premium? And would this be added to just any other claims? For instance, tree fell over on the family car, and then 7 months later, a deer runs into, another one of the family cars. Is it cumulative claims, or is it repeated claims for the same type of accident and animal strike?
Senator, I can only give you an overview, and I think if you want to dig down into the details, we'd need the MIA to come back with some detailed information on that. But Senator Bailey correctly summarized the study, and I would encourage you and your fellow committee members to take a look at that study that the MIA did a couple years ago. It's really quite helpful, I think. In terms of pricing for deer collisions, it's really, there is no one size fits all. Only a very few, a handful, I think 7 was in the report, charge for an individual deer collision. And a like number don't make any charge at all, and others apply it as a factor. So I can't answer your question, how many deer strikes does it take for me to have my premium increase or I lose my coverage or something like that? It depends. We have close to 150 motor vehicle insurers in the state, and you don't have 150 different approaches, but you have many. So unfortunately, I can't generalize for you.
So it sounds like it was incredibly random that the insurer for the good Senator Bailey just decided, okay, he's been struck, and now we're going to raise his premium, and another insurer may have looked at it and said, oh, heck no, we're not worried about it. So wouldn't there be some consistency if we were to pass this legislation to ensure that an accident claim due to no fault of the individual, that it's a random animal strike, would not in fact affect their premium and their claims, as opposed to having a hit or miss, policy here where, yeah, okay, on this occasion it is, nope, on that occasion it's not going to. And I can understand the notion that if somebody has dead trees surrounding their house and they've had repeated claims because during heavy winds, tree snaps, cracks the roof, lands on the vehicle, as opposed to a circumstance similar to Senator Bailey's, where you're sitting there minding your own business and a wild animal runs in, strikes your vehicle, and suddenly his premium, he's probably been paying for his insurance for decades. Suddenly there's a claim, and boom, now the insurance company is going to jump on the opportunity to increase the premium, and all those years of paying those premiums, that doesn't matter. So I'm just trying to understand why we would not allow Maryland law to ensure that the randomness of what this is not something that falls back on the individual. And I also, to your point, that spreading out these losses over all of your insured does help protect the good senator when you're in a circumstance like this. And that's the whole point of having the insurance, is that you're spreading it out over everyone who's insured, whether they happen to, you know, live in an area where maybe there's a greater chance or a lesser chance of having a deer strike. You know, you just made the point yourself saying it's everywhere. And so it is everywhere. So shouldn't this be a burden shared by everyone to ensure that a particular individual is not suddenly punished?
It's a temptingly simple solution, which we would resist for what I hope are logical reasons. We've got, what, 4 million cars in this state? Most of them, we're all supposed to have insurance. Almost all of us do. So you take that loss and you'd be spreading it out over lots of people who never even came close to a deer, much less hit one. We have a system of insurance that is risk-based and comprehensive, even comprehensive, which is viewed as kind of, in this setting, kind of no risk. It's the tree falling, it's the getting hit by the deer. Some people have those collisions because, as Senator Motz pointed out, and I believe Senator Bailey would agree, in some states of this, in some areas of the state, the risk is higher than it is in other areas of the state. And we depend on our insurance regulator to make sure that risks are allocated fairly in the rating plans that each insurer has. And I would repeat, there are some insurers, not many, there are some that don't charge for these at all. There are a few that charge directly. There are others that charge it in some way. And Senator Motz gave you the right advice. Out of those 150, pick a few, shop, and you will find a lower
I
rate.
appreciate that. How many of our residents in the state of Maryland who are carrying automobile insurance, Bryson, do you really believe pick up the phone, they call their insurance broker and say, hey, if I am struck by a wild boar or an angry doe that just took a look, saw me wearing my hunting attire, am I going to lose coverage? And my guess is the answer is going to be, we don't know. It's going to just depend on what the rest of your claims are. And so there's very unlikely anybody finds out until it's after the fact. And secondly, if they could even get an answer. So it just seems to me that a bill like this is protecting everyone from a random event over which they have no control whatsoever. And that would be an appropriate and logical way to address this. And yes, if somebody lives and I'd be shocked if somehow St. Mary's, there's more deer strikes than what I get in Montgomery County. My motorcycle goes into the garage in November just because once it's rutting season, I am not going to be out on the road on two wheels. And that's Montgomery County. We're hardly rural. And I get, to Senator Motz's point, yeah, this is a management issue. And by the way, Maryland at one point was pretty much white-tailed deer free in the late 1800s, early 1900s. It was our Department of Agriculture that reintroduced the white-tailed deer for purposes of hunting that we have this problem now. And, but it's here. And yeah, I get it. We should do what we can. There are sterilization programs, and we need to probably quadruple down on that. But in the meantime, it just seems to me that everybody should share in whatever the costs are in something that is a completely random event over which an individual has absolutely no control.
Senator, a two-part quick response to your question. The first one about your hypothetical about calling the company or the agent saying, what happens if I hit a deer, have a deer collision? If they don't know, they better find out for you. They're obligated to do that. So I used to be an agent myself, just as the chair was. We got those kinds of questions all the time. We have to get answers to it, to those. Another thing that I'm not suggesting this, but I'm just saying you do periodically when you see a public issue that doesn't require legislative action but does require consumer information, you recommend to the MIA that they put a bulletin out or put information out. And I think this might be a subject that, based on your very eloquent description there, might be appropriate for raising the public profile of as part of what we're doing.
Well, God bless, I'd be willing to bet that less than 0.1% of those who are out there with auto insurance would ever see any bulletin put out by our dear friends at the MIA, and I love them. They're sitting right back here today. And but I think realistically, we know that's not an effective mechanism to address the issue. But I do appreciate the conversation, so thank you very much. Always
Thank you,
good
Senator.
to see you, my friend.
Thank you.
And hopefully Senator Bailey will become my friend as well. I'll keep working on that.
And I'll
Thank
work
you,
on it
Madam
for
Chair.
you.
I don't see any other questions. That ends the hearing on Senate Bill 304, and
Thank you,
it
Madam
ends the hearing for today. Thank you very much.